Okay, everybody, I think we are ready to get going. I am excited this morning for everyone that have decided to join us. There's still people coming in, and we're going to let them in as they come, but we don't want to waste no more time because it's going to be very valuable today. We're going to get some valuable information, and so we want to be able to take time to really talk and to have dialogue and to answer as many questions as we have. So before we get started, I want to pray. I want to pray. This is the day that the Lord has made. Let us all rejoice and be glad in it. I don't know about you, but I am so happy that I was on God's wake up list this morning. I
Hallelujah.
am glad. I'm so glad that I was on his wake up list this morning. I'm glad to be in the land of the living. Those of you that don't know me, my name is Bishop Hezekiah Walker. I am the presiding prelate of the Pentecostal Churches of Jesus Christ and also the senior pastor of the Kingdom Church, the Love Fellowship Tabernacle Church, both in New York City and in Ben Salem. So before we get started, I want to pray. So let's pray, and we're going to pray that God will bless our afternoon. All right. Father, in Jesus' name, we look to you this morning. We're asking that you would help us today. God, we have come together to get some clear understanding about this COVID-19 vaccine. You said that your people are destroyed because of a lack of knowledge. So this morning we come to get knowledge, we come to get understanding, and we come to get facts. And I pray in the name of the Lord that you will use each of our facilitators as they come this morning to share with the people. I pray, Father, that you will be glorified and you will be magnified in everything that we do from this moment on. In Jesus' name we pray. Let everybody say amen.
Amen.
So we thank the Lord for this time again. I am happy to be with you. My name is Bishop Hezekiah Walker, and I want to thank God for all of the people that are on this morning, especially those of you that are from our fellowship and from our local churches, and everyone who have committed to be on this morning, because this is what it's going to take for us in order for us to get through this COVID season and to understand this vaccine. So we have decided to get together, amen, with a group of people that have the knowledge, that have the facts, and that can give us exactly what we need. And I'm grateful. The Bible says that he that would have friends must first show himself friendly. And one of the things that I believe that this pandemic has done, it has sent this awakening spirit through the body of Christ that we can no longer be separated, segregated, that we all have to do this together. I really believe the scriptures where it talks about unity, where there is unity, there is what? There is strength. So I thank God for the collaboration this morning with the AME Church, and I'm so excited that they consented to be with me this morning, and well, actually this afternoon, and I am excited to have them. And I think that each and every one of us is going to walk away from this meeting with a better understanding of COVID-19 and especially the COVID-19 vaccine. This is going to be a great conversation. We are here this morning to equip you, to educate you, to empower you, because you need to be empowered as you make this decision. You know, we have to be empowered before we make any decisions. We have to be educated. We have to be equipped with the right tools and information and facts. I was talking to our mayor this week in New York City, and I was sharing with him about I was sharing with him about the fact that in our community, the African American community, we don't really get the information until last minute, and then when we do get the information, some of the information is not accurate. And so my aim and my goal this morning is to get clear information, clear facts. I want We want to be equipped when we walk away from this. We want to be educated when we walk away from from this. And so I'm looking for the Lord to bless us. We're going to have Q&A, and I'm excited about that. So I want everyone to get your questions ready, to get your comments ready, to put in the chat so that we can answer as many questions as we can. Our sponsors will be, jumping in and out and to answer whatever we need to be answered. The presentations that we're going to give you will be 15 minutes or less, but we need you to sit, attentively and to listen. And I want to share this before we do anything else, because the scripture says, he that have an ear, let him hear. And we have to put on our ear this morning, because we have to hear what God is saying to us. We have to hear what God is saying to our church, all right, and to the church rather. So I need everyone to please, I need you to sit with some open ears. Your ears have to be open, all right, to hear our experts this morning, because that's what they are. They're experts, and I want you to hear them and hear them clearly. We're going to even be talking about how to overcome the COVID-19 pandemic. Many of us are just fatigued with it, and we got to get through it. So we need to talk about that. We're going to give you some great recommendations. All right. So I definitely want you to really stay close and hear what God is saying today. And also too, I had someone was hitting me up all week long about are we going to be talking about the science of it all? Yes, indeed. Yes, indeed. We will be talking about the science of it all today as well. So I just need you to really pay very close attention, because it's going to be a help to each and every one of us. It's going to be a great help to our health, and it's going to empower us like you would never believe. Your health and your wealth is very important to the body of Christ. So we want you not only to be spiritually nourished today, but we want you to be naturally nourished today as well. All right. He said that we would prosper and be in what? And be in good health. So having said all of that, we're going to get things rolling. And I am so happy that he is with us this morning. I am so elated when I found out that he was going to be a part of this. I had thumbs up, all right? And he is the International Health Commission chairperson for the AME Church. And I'm glad that he is with us today. So I need everybody right now, please get excited for Bishop Harry C. Wright.
Amen. Thank you, Bishop Hezekiah Walker. We thank you for your kind words, presentation. Also, you have said some valuable things in a person of your character, and as well as being an international figure. We are so grateful to partner with you in this collaborative effort. We are excited about the Health Commission. I am Harry L. C. Wright, the presiding bishop of the state of Alabama, known as the 9th Episcopal District. I am the 133rd elected and consecrated bishop in the African Methodist Episcopal Church, having been elected in 2016. I have been honored to be the chairperson of the Commission on Health, and I just want to say how elated we are to have such a wonderful team of people. We have some of the top people in the country as advisors and as director and executive director and all the other components that make up the Health Commission. So today we're excited about what's going to take place. We want, as Bishop Walker has already said, please set in your tent, those pay close attention, because this information is not available to everybody. We're just so glad how many people are now citing the Health Commission to the place to get advice as we battle this pandemic. So it gives me great pleasure now to present the director of our Health Commission, Dr. Marion Burnett. She has many specialties. She specializes in public health administration. She is a medical doctor who is well versed, well knowledgeable of all that needs to take place, and has gathered a wonderful team of professionals who are also spiritually led. That's what I'm so excited about. All of these persons are believers in Jesus Christ, from scientists to that special, let me just say, that specialize in their special areas. So at this time, it gives me once again great pleasure to present to you our Director of the Health Commission, Dr. Marianne Burnett.
Good afternoon, all. It is my pleasure to be with you. I hope that, and on behalf of the Health Commission of the African Methodist Episcopal Church, thank you, Bishop Seawright, Bishop Walker. It is our pleasure to provide you all with the knowledge that God has allowed us to attain. It does us no good if we cannot share it with the world. And so we come at this time to be able to share what we know, answer your questions, and provide direction so that you may make your own informed decisions going forward, so that you will be safe as best as you can humanly be, and that you will be guided in your prayers to God so you can know what you can be specific in your requests. I now introduce our Executive Director, Reverend Natalie Mitchum, one who I now call friend and have for years. Thank you.
Thank you so much, Dr. Burnett. And again, I too thank Bishop Walker and Bishop Seawright, and certainly working with this team. It is a pleasure. What I wanted to share with you, if you're able to see the screen, is the mission of the International Health Commission of the AME Church. I'm not going to read all of it, but what you see happening today as part of our mission is to collaborate with ecumenical interfaith health projects while promoting health as a part of our the screen is advancing on its own, as a part of our outreach and advocating for health as a right, not a privilege, forming collaborative relationships internationally, nationally, regionally, locally. And this is what you see us doing today. So we're excited. And as you know, many of you who are my friends and family, a part of PCJC, I'm also a happy, proud member of PCJC Fellowship. So we're excited about this partnership together. So at this time, just to remind you, please do make sure you put your questions in the chat box. As Bishop Walker has said, he will be guiding the question and answer session when we get to the end. Also, because we have so many persons from around the world, you can also put in hello and where you're from, what state or country. We look forward to you also doing that. That would be great. And grab a pen and piece of paper so you can take notes. So at this time, and I'm not quite sure why the screen is moving on its own. So James, I'm not moving it. So, but I'm going to introduce our first speaker. I will attempt to move it to her bio. It was just up. Okay, so our first speaker is Dr. Weta Collins. We will not be reading all of the bio. You see everyone's bio. We provided for you. We're just going to give you the highlights. She's a board certified physician by the American Board of Family Medicine. She also has a master's degree in public health with a focus on community health and administration. As you see her medical credentials, where she graduated from. Going down to the bottom, Dr. Collins works primarily as a hospitalist physician and has been working on the front line of the COVID-19 pandemic at a local New Orleans hospital. So at this time, Dr. Collins.
Good morning. Can you hear me?
We hear you.
All right. Thank you so much for having me today. It is definitely an honor to be here with such a distinguished panel. Thank you to Bishop Hezekiah Walker and the Pentecostal Churches of Jesus Christ. And also special thank you to Bishop Harry Seawright, who guides the Health Commission and really keeps us covered. What we're going to talk about today really is try to give you what I call the real deal, just upfront and let you know what happens on the front line with COVID-19, and certainly we'll be able to answer questions. Our goal today really is to help equip you with the information that you need to make an informed decision regarding the COVID-19 vaccine. We want to discuss the pros and cons, the benefits versus the risk. We even go into, some of us are going to share our personal reasons as to why we will or will not take the vaccine at this time. Please remember that any of this information that we give you does not replace the recommendations of your personal physician. And in fact, we would like for you to consult your personal physician regarding your health care and your health decisions. We know that vaccines have had a positive impact overall with preventing and decreasing the spread of disease. Many of us have decided to take vaccines in the past that have included the chickenpox vaccine, flu vaccine, measles, mumps, rubella, and various other vaccines. But I want you to keep in mind that although vaccines have helped, they are not the treatment of choice. They're not the treatment of choice, nor will they cure everything, especially when it comes to COVID-19. The treatment of choice, anytime you come in contact with any type of infectious disease or contagion, what you want to do is avoid the offending agent, meaning stay away from it. Don't go near it, leave it alone. There's always that joke, Doc, when I move my arm like this, it hurts. And the punchline is, well, don't move your arm like this. If you don't want COVID-19, the point is to try to stay away from it and avoid the offending agent. And that's when we come to talk about properly wearing your mask all the time, covering your nose and your mouth, avoiding gathering, social distancing, sanitation, and minimizing your interactions with persons outside of your home. You also, during this time, want to increase your chance of remaining healthy. And this is with COVID-19 or any other illness. You have to control your comorbidities. Persons of color, specifically African Americans, we contribute to heart disease because of diabetes, obesity, and hypertension that's uncontrolled. Heart disease is the #1 killer of Americans. However, COVID-19 is making progress to knock it out of that position. So we really want to make sure that we control our comorbidities. We watch our diet, and Reverend Natalie is going to speak on that, but we want fresh, non-processed foods. And it's going to be most important that you do that. Exercise with COVID-19. Even if you have COVID-19, we're telling people, keep moving, get up. The fatigue is there, but we want you to keep moving. We also have people recommend a lot of times, and even with treatment, that people take high doses of vitamin C, vitamin D3, and zinc. And we're looking at higher doses than normal. Vitamin C, we're looking at about 500 milligrams twice a day. Vitamin D3, 1,000 to 4,000 units per day, and zinc about 75 milligrams to 100 milligrams per day. Is where we are. So as of this past Thursday, and it has been all over the news that our cases are exploding, we are now over 300,000 deaths in this country, 306,427 people, and that was Thursday, with an average of about 3,000 deaths per day. So we know that we are increasing. Where we were, even if we look at September, we were at about 42,000 cases. 2 months later, we are at 198,000. And a month from there, we are again at 300,000 cases. This is the plague, ladies and gentlemen. This is the plague. It's not locust. This is the plague. This virus is our modern day plague. And with any plague, you begin to walk through the valley of shadow of death. So on my way to and from work, I started walking because remember, we need to increase our exercise with this. And I repeated the 23rd Psalms going and coming from work. Because during that time, when you literally have people around you, you know, fear can take over. If fear takes over, then you're not able to do as well. So there has to be that understanding that God is with me and I'm not going to fear this evil that is going on. And that every afternoon after every shift, he's going to restore me. And that certainly because of all of this, I'll have goodness and mercy following me. What happens when you go into the hospital? This is a picture of a team, and they have proned this patient, meaning they have turned this patient. If you look at the person's feet, they've turned them over onto their stomach. And what we're trying to do is increase their ventilation and improve their oxygenation. I can look at the picture and see that the person is already on life support. There's a ventilator there. There's several drips that are going, and he is definitely in critical condition. Even looking at the bed that he's laying on is going to move to try to prevent him from getting bed sores. So what happens when you go into the hospital? You'll be seen in the emergency room by the ER physician. They will evaluate you, do an initial assessment, and if necessary, they will decide that you need to be admitted. At that time, they will call two people. One will be someone like me, who's a hospitalist. A hospital physician is someone who only takes care of persons in the hospital. I'll receive a call from the ER physician. They will tell me what's going on with you. They may say this is a 56-year-old female patient who presented to the hospital with increasing shortness of breath and a fever of 102 or greater. And we'll go on and discuss your case. We'll then determine what has already been done in the emergency room. If there's something else that I suggest that needs to be done immediately while they're there, and we'll determine if you can go to a regular room or to the intensive care. After that, the ER physician will call the house supervisor. The house supervisor manages the beds in the hospital and will say, yes, we have a bed, no, we don't. And so this is when you see, when there are no beds, how people end up staying in the emergency room or in the hallway. If you're at a hospital and they don't have an ICU or a smaller bed or something that you need, then the physician has to start looking to try to get you to another hospital. But that hospital cannot accept you if they don't have a bed and if there's not a physician there. With COVID-19 and the numbers going up, and the reason why you keep hearing us about beds is because as those numbers increase, there's no bed. And people stay in the hospital with coronavirus for months. And so it's not like there's a bed clearing up. And so sometimes persons are shipped to hospitals in parts of the state that are not near their family members. They can be 2, 3, 4 hours away because that's where the closest bed is. So what happens with COVID-19? What happens that all these people are so sick, all these people are dying, and it seems to just be happening very quickly. You see someone go in and then they're not. This disease attacks. It attacks. It is trying to kill you. It is a virus. It tries to shut everything down, all of your organs. And this is what we call multi-system organ failure. It is going to try to hit your kidneys. It's going to hit your lungs, your heart, your brain. Anything that it can attack, it will do it. It takes every opportunity to suffocate and strangle someone. And so this is not like there's a beast where we can come in and just hit it over the head. We can't see it, but we know that it's there doing it. And while it's trying to literally steal your life and your breath away, your blood thickens. And so we have you on anticoagulants, things to try to thin your blood, but it tries to thicken it so quickly that you can get a blood clot that goes to the brain or decrease blood flow to the brain, causing a stroke. You can have a heart attack. You can have what's called a pulmonary embolism, which is a clot going to the lung, which can kill you immediately. We have people having amputations because there's not enough blood flow. And so those clots and the thickening decreases the blood flow and the persons get gangrene and we're having to amputate. This is a cascade of events, which means when it starts, it happens quickly. And so what we're trying to do is slow it down to treat. But this cascade of events has killed over 300,000 people in the United States in less than a year. This occurred this week. It's a voicemail from a mother to her child. This has happened about 4 a.m. This patient had been in the hospital for about 3 weeks. They have received some of everything. Everything that was available to treat them, they have received, but was still declining. And the voicemail goes, "Hi, baby, I love you. They're going to intubate me now. I'm not good." That's the voicemail that people are waking up with. And that's the risk that you take when you decide, well, I'm just gonna go out here. It's not gonna be that long. Or I wanna take this picture, so I'm gonna just take my mask off and do it here. Or I hate wearing a mask, so I'm gonna put it below my nose. This is what is at stake. And so when we have this opportunity issue and you come into the hospital, and really outside of COVID, this should be asked, but you're going to be asking, you should ask yourself this question today and be able to answer it and discuss it with your family. If your heart were to stop beating and you were to stop breathing, do you want us to resuscitate you? Meaning, do you want me to stick a breathing tube down your throat, put you on life support, and perform chest compressions? The picture that you see is someone being intubated. At the end of this scope is a blade. That blade could be 6 inches, it could be 7. And the physician is the physician of choice if they want to use a curved blade or a straight. I prefer straight. I'm going to take that blade and go directly into the very back of your throat to the end, lift up on your tongue, pull it back. Hopefully don't break any of your teeth. I'm going to wait and look at till I visualize your vocal cords. And when I do, and your vocal cords open, I'm going to slip the second tube that you see that has a stylet in it down in between your vocal cords into your breathing tube and stop just before your lungs. We'll pull that out, put a balloon in. I'll put a bag on to make sure that I'm in the right location and that I didn't go into your stomach. It's not TV, ladies and gentlemen. This is not TV. If we can go back one slide, please. James, thank you. So code status is what we're talking about. And this is the discussion that you should have anyway. A full code means that if your heart stops beating or you stop breathing, then we will perform chest compressions and we will intubate. We'll do everything medically to treat you. A partial code, they are people who come in, and generally they're elderly people, and they're, "Doc, you can do whatever you want to, but don't put me on the machine. I do not want to be on life support. I don't want to be on a breathing machine." And so that's a partial code, and that just means we won't intubate you. We'll go as far as putting you on BiPAP, which is right before you're intubated, but we will not intubate you. Do not resuscitate means that we will do everything possible. We will continue to treat you. It does not mean that do not treat, do not resuscitate. A lot of times we're like, well, I want to do everything. Do not resuscitate doesn't mean don't treat. What it means is that if your heart stops beating or you stop breathing, we won't put you on life support. We won't stick that tube down your throat, and we won't do chest compressions. Comfort measures means, and a lot of times this is done at the very end of life, or occasionally if someone's on hospice, and you can vacillate between do not resuscitate and comfort measures. And at that time, the family or the person may say, "I just want to go peacefully to be with the Lord. Just make me comfortable. I don't want to suffer." And so that becomes our sole focus. We're not following and chasing after your blood pressure. We're not going to be poking you and drawing blood and labs and all of that. Our focus then becomes to make you comfortable. Next slide, please. So with COVID-19, there's certainly been, and I'm sure you've all heard it, there's some untruths that have been spoken. And so I want to take the opportunity to clarify that. Physicians do not get paid a bonus for diagnosing COVID-19. We are not the ones who generally take the specimen. It goes to the lab. We don't see, and then the results are sent to us. We do not get paid extra for signing death certificates. During this time, many of us, even when we're off and we, work long shifts, we're signing those on our days off. We do not get a paycheck for taking the COVID vaccine. We will not receive any additional funds if you choose to take the vaccine or if you choose not to take it. We do not get paid based on your code status. All of those things are not correct. So vaccinate or not vaccinate. And these two photographs really shows where a lot of physicians are with this. And we had the same discussions and concerns that everyone does. We are fatigued, it's stressing, it's depressing, and to know that you're doing everything that you can and that people are still going to die. And when your prayer is Father, let them go peacefully, because it is a struggle. It is a fight. It's not TV. To watch people day in and day out, despite your best efforts, struggle and die. We are getting to the point now where just in this past week, constantly getting emails and texts that Dr. So-and-so's in the hospital, they're in ICU, because our exposure has gone up so much because we're seeing people on a regular basis and the risk. And so then the other part is that we don't want to continue seeing pictures like this. We don't want to continue seeing air-conditioned trucks outside. We don't want to continue to have to call you and try to FaceTime you so that you can say goodbye over the phone. One of my friends was saying one of the worst things about this is to hear families on the phone wailing, and there's nothing that you can do about it. And there's nobody there to comfort them. And the best that you can do is try to stand there with a camera so they can say their last goodbye. So we're still talking about the vaccinate or not. What are the pros and cons? This cons are, there hasn't been long-term studies. This is not FDA approved. Certainly, their healthcare system has not earned the trust of African Americans or other people of color. All of our questions can't be answered. How can I be certain that they're going to keep this at the right temperature? All of those are concerns, the same concerns that you have. But I also have to look at what I do. I travel. I work in 3 states. And so I travel to work. Tom Joyner was the fly jock. I want to be the fly doc. So I fly. I want to practice in more than one place. And I'm not the only physician that does that. But traveling puts me at increased risk. My exposure is certainly more than the general population and can be more than other physicians. There's a poor public response to wearing masks and social distancing. You see it. You see that. We're at an increased exposure from infection and illness because we're having to work together. One of the biggest risks is intubating somebody, putting them on life support, because when you do that, your head is directly over theirs. And there are all types of things that are spraying. The number of cases continue to rise. The illness, the mental fatigue. I have hypertension, although it's well controlled. We're at a greater risk. And so the question then becomes the risk of me catching COVID and surviving. Because if a doctor gets sick, we generally have been exposed, we build up some immunity and all of that, but repetitive exposure increases your risk, and that increased risk increases the possibility of death. This is a patient I took care of. You can read her story if you just put in your timeline, mother released from hospital with COVID in New Orleans. This lady came in sick, and OBs did an emergency C-section. When I got in that morning, they were going through telling me what happened. And I'm thinking, was she in a car accident? What happened? Why did all this? And everybody froze. She has coronavirus. And you just like, wait a minute, she's pregnant, she's young, she's otherwise healthy. And she stayed in the hospital 72 days. She not only was my patient, but after, so long in the hospital, you're everybody's. And so, we prayed, we signed cards, but it's difficult. Those first few days talking to her husband saying, this is our first baby. He hadn't seen his mama. So that's another reason to stop having issues like this. So the answer is yes, because of all those reasons, because of my risk, because of my level of exposure, then I will be receiving the vaccine. Thank you so much.
Thank you, Dr. Collins. What a powerful view that you've given us, allowing us to take a look at your personal experience in a hospital, and allowing us to see how you made a decision that, yes, you will take the COVID-19 vaccine.
Reverend Natalie, you have an echo.
I'll try to correct that. Our next speaker, I'll have Bishop Walker introduce her since I have an echo. I think maybe I've taken care of it. Is that better? Yes? Okay.
Yes, resolved.
Okay, fantastic. So we have Dr. Fuller. Dr. Fuller, she's the Associate Professor of Microbiology and Immunology in the Medical School, Faculty and STEM Initiative of African Studies at the University of Michigan. She is an adjunct professor at Payne Theological Seminary. She's also an itinerant elder in the AME Church. We just want to make sure you also understand her experience as a scientist who teaches and studies viruses as a virologist. See, I was trying to pronounce that, virologist. Dr. Fuller's laboratory term, a team published research on herpes simplex, influenza virus. She teaches, as we said, at the University of Michigan to graduate students, dental students, undergrads. And so at this time, we introduce to you Dr. Fuller, PhD. We're going to stop sharing the slide for a second so that she can bring her slides up. While she's bringing her slides up, we encourage you again, you can write your questions in the chat box. Please make sure you do stay on mute. That does help prevent the background noise that I think that I was getting. We also are asking you to tell us where you're from, what country, what state you're from, what church you're from. We'd like to see your hellos. And again, we will have a question and answer session at the end, giving Dr. Fuller an opportunity to bring up her slides. You cannot bring up your slides. I see her shaking her head no. Okay. So we have a technician person, James. Okay, so you're muted, Dr. Fuller. So I see you talking to me. Can you unmute or you can't unmute? You can't unmute. Okay. So James.
Oh, there we go.
There you go.
All right. Okay, so I'm unmuted. Thank you so much. Good morning or good afternoon to everyone. And I still cannot yet share my slides, so it tells me. But it is, I'm grateful for the opportunity to join the International Health Commission and Bishop Walker and all of you here on this day, in this time when we are all trying together to navigate this time. I do have slides to show, but I want to thank Dr. Collins for kicking us off with such a realistic view of where we are. And hopefully what I will try to do, if I can get a screen share, is to show you why we are there and how COVID works, a little bit about the vaccines, and then what we each must do together in order to get through this time. There's a saying that the darkest hour is just before dawn. I was blessed to be on the panel, the FDA advisory group that reviewed the Pfizer and Moderna vaccines. And so the question we were asked is, do the benefits outweigh the risk? And we're saying that you have to make up your mind for yourself. I said no for the first one, not because I don't believe in vaccines, but because the transparency of what was true for these viruses was not allowed to come forth in the time that we had. The process of review was changed for the second one, and there was lots more information, lots more questions answered, such that we know what's known and we know what's not known. And that, I think, is critical information for you to be able to make up your mind with advice of those you trust and physicians and other people to decide what to do. James, I still cannot share the slides. I don't know if you can make me a co-host in order to be able to do that.
Oh, okay, that's it. Yeah, that is it. Bishop Walker, can you make, because she arrived late, yes.
Yeah, I was coming from an NAACP event in Arizona. It's wonderful that we are in a virtual time in some ways because it allows us to do things. The reason we're in a virtual time is not wonderful though. Okay, so it still says I'm disabled. What I'm going to
Bishop
do.
Walker is working, he's working on it for you. 1 second.
What I'm going to do when the slides come up is I'm going to give you a little bit of a view of where we are at the moment, just to reemphasize what Dr. Collins has said, a little bit about why this virus has been able to do what it's done in 10 months, how it affects your body, what preventions we have, what the vaccines are, and then hopefully a message that we all have to be proactive with both the preventions that we know and that we haven't used. At the other event, I really left there. I think they think I'm an angry woman, but I guess I am, because in some ways we didn't have to get where we are. This was totally unnecessary. If folks had listened, we're saying don't gather during the holidays, don't gather with people. This is not the time. If we do that now, we'll be able to gather next year with the ones we love. But if we don't do that now, a lot of the people we love will not be here next year. And we will go through this very tough time, which is what's happening. Thank you. The slides I can share now. Praise God, from whom all blessings flow.
Amen.
All right, so hopefully you can see my screen. Is that right?
Yes, ma'am.
All right, so looking at COVID-19 in this symposium, and thank you to Bishop Walker and all of those who are responsible for putting this together. We're so grateful that you thought it not robbery to do so and invited us to participate. So where we are now, you saw this a little bit, but I just want to reorient us. This virus started in regions of China in December of last year and has now migrated throughout the world to cause a pandemic. You see the US in this purple color because we are the leading country with the number of COVID cases, which is amazing since we're such a developed country. Why are we not able to do this? There's some reasons that I won't say on the air, and some I will, that we just have not followed what God has given us. And that is dismal. This shows you the US compared to other developed countries, and this was as of October. This shows you now where we are. This is, I took this yesterday or the day before, where in March, when Michigan shut down, the governor shut down the state. We were somewhere in here. And then when we reopened in June, the national cases were here. In July, after the events that happened around George Floyd's murder, the 4th of July holiday, we went up to a high for the USA. And even now, we're so much higher. We're 4 times higher than we were at the worst phase of this epidemic before, with some 17.4 million known, and that's not mentioning the unknown people who have reported positive to COVID, and over 200,000 per day occurring, with over 300,000 deaths of mothers and brothers and sisters and dads and granddads and uncles and aunties. This should not have happened. People have just not done what we could have done to make a difference. But here's where we are. So how does COVID transmit? This is a respiratory virus. It actually replicates in nasal passages in the throat. So when we breathe or talk or sing, we end up with virus particles in the air droplets and respiratory droplets that go out. So transmission of these and just normal talking can be within 6 feet. So anybody standing within 6 feet for someone who's just doing normal talking, not only sneezing or coughing, can breathe in the aerosols and the respiratory droplets into our nasal passages, which is where the virus begins to replicate in these tissues lining the nasal passages and throat. It then travels down the windpipe into the bronchi, into the lungs. So anyone who is nearby, who is breathing, singing, talking, exercising, coughing, or sneezing can transmit this into the air if their nasal passages have been infected. Even if we touch something that these droplets land on, we can transmit those into our nasal passages to start this very tenacious virus replicating. And by the way, this virus is not cruel. It isn't even a person or has any personal qualifications. It's a microbe that's just trying to reproduce itself, just like all of us have to do. So it is only a villain because we have allowed it to be a villain. It's just a natural biological God-made, a God-allowed microbe to occur. And I don't believe God made it. These things happen all the time. It's just that this one was able to travel from within animals to us. The coronavirus spread has occurred from China back in December when it first emerged. It went from a bat, which is its natural habitat, into humans by some means. And so it adapted itself to be able to replicate very quickly and efficiently in humans. This is a picture of a portion of a cell that's producing coronavirus. The whole cell would be bigger than my screen, but this shows you that one cell produces hundreds of virus. These are all children made by infection of this one cell, by virus progeny. This is an example of how easy it is to spread coronavirus 2. This person early on, back in February or January, went from Singapore to France for a ski weekend. They shared a chalet with 12 other people. Out of that 2 to 3 days of being in the same household, if you will, the same cabin, the same chalet, over 21 other people were infected in 4 different countries, just sharing the same air as this one asymptomatic person who did not know that they were infected. They found out on January 28th that they were not well and were diagnosed on February 6th. And all these other people in red, as well as the people they came in contact with, ultimately were diagnosed with coronavirus infection. So this is highly infectious. It's an airborne virus. This is another example from here in Michigan after the governor reopened the state in June. This is a bar where many of the Michigan State University students frequent. And obviously when you're in a bar or in other social gatherings, in a church even, you're not covering your mouth, you're not 6 feet away. So even in the middle of the pandemic, enough people were in that bar, somebody was asymptomatically infected, or some persons, such that over 120 young adults tested positive to coronavirus. And that, you don't know how many related or connected with those people tested positive. So this is a gathering that we cannot do. Here's another example. This was early on in the pandemic as well. This is from a report in a restaurant indoors where the air conditioning flowed from here over these 3 tables. There were people at 5 different tables. Someone at table 1A1 was asymptomatically infected, did not know they were infected. They were in that restaurant for 53 minutes with people at table B and 73 minutes with people at table C. The circles show you people that got infected with this virus, some of them being the person's family members, but others from completely different families, which helped us to know that this is actually communicated through aerosols. So what do you need to know? Do not gather. Do not go to someone's home for Thanksgiving or now for Christmas or any other time. It's important that we understand that any gathering of people from different households, even if they're related, even if they're your sister, even if they're your best buddy, even if they've been in a bubble with you, unless you know that they're negative and you're negative and you've not been around any other persons, don't get together. The more people that get together, the longer time they're together, over 15 minutes, the greater the risk of transmitting coronavirus from someone who's asymptomatically infected or pre-symptomatic. How do we determine if it's COVID-19? The only way to know is to get a test. The early symptoms look very much like other respiratory symptoms. So you can't say, I've got a sniffle, oh, it must be coronavirus. You have to get tested. And this is the CDC site where you can go to put in your zip code to find out what's the closest testing site near you. What does coronavirus do to the body? Again, this is what happens when we breathe or sneeze or cough or sing. The virus timeline is from initial exposure in whatever way we come in contact with it. Through 14 days, the virus can possibly show up if it is in our body. Typically, the symptoms begin to show up, if they're going to be symptoms, somewhere around the 4th or 5th day. But the interesting thing is that the virus is produced before then. So there's asymptomatic shedding before we know we're infected, which is what happened in this case. This person did not know they were infected. This person did not know they were infected. So hence the rules of wearing masks, social distancing, not gathering are critical. From the time of exposure, the symptoms appear can be a fever, a headache that I'm told just won't go away, a dry cough. Now we're finding many people have a loss of taste or smell and other symptoms. And these can develop anywhere from 2 to 14 days. So the quarantine time from possible exposure is from 10 to 14 days after that, to make sure that there is not enough virus that you have received or you haven't received virus at all to lead to infection. Infection can lead to mild, moderate, or severe illness, or as I mentioned, there can be no symptoms. And about 40% of the transmissions are from people who don't even know they're expressing virus. There's no symptoms. What you get depends on how much virus you come in contact with, how long you're around people who are expressing virus, the state of your immune status, and other underlying conditions. What does COVID do to the body, or coronavirus do to the body? These are the symptoms I already told you about. When the virus gets into the nasal passages, it begins to replicate, and symptoms start in the back of the throat with a dry cough. The virus then travels down the windpipe that Dr. Collins showed you in the intubation process. There's a battle going on between what the virus needs to do to replicate and what the host does naturally to keep anything that's not self out of the body. So there's a battle going on. And what happens is inflammation, cell damage, excess mucus. When that gets into the lungs and travels from the windpipe into the bronchi, this is what a normal healthy lung looks like in an X-ray. You can see the air pockets. This is an up close now of the smaller area here where we see the air sacs, the alveoli that normally exchange carbon dioxide from the body for oxygen coming in when we breathe. This is a healthy looking lung. These are open sacs with very thin membranes around it. In contrast, when we get pneumonia, or when the virus, when coronavirus or even influenza infects this area, there's inflammation from the immune response from the virus reproducing, such that these tissues thicken up. There's lots of mucus, and so there's no longer air passing through these. And we have difficulty breathing. Fluid builds up in the lung, known as pneumonia, and that's what you see on this X-ray. These are fluid-filled lungs where air is not passing. So people feel like they can't breathe. They have an elephant on their chest. They cannot get air out and in. And so the oxygen restriction going into the bloodstream then can affect other major organs like the heart, the lungs, the kidney, the skin. So this is the issue that COVID infection leads to. Whether it's mild or moderate, usually there's some infection and inflammation in the lungs. It not only causes issues with the respiratory tract, but because of the lack of oxygen and other factors that we don't understand, it can have a systemic infection. People report different aspects of this. Not everybody gets all of these. Brain damage from blood clots, neurological symptoms, pink eye is one of the more milder ones, and as is loss of smell and taste. So we know that it's affecting the nervous system. Blood clotting, GI tracts, vomiting and diarrhea. heart disease, arrhythmias, heart attacks from the clots. Kidneys get damaged. Many COVID patients end up on dialysis while in the hospital and have kidney issues if they recover. Skin issues, immune response. So what happens when someone gets severe COVID, as was already mentioned by our physician, is that we give them oxygen, and if necessary, we put them on a mechanical ventilator. What happens is a result of how much we can support the patients through while their body is fighting through these major issues. That can either lead to survival or it leads to death. And right now we're not doing well with stopping death. And even if we survive, there are long-term effects. So this shows you there's something called long hauler syndrome, where even people who recover from even mild to severe infections have symptoms for months, weeks and months after they've, quote, gotten over the virus. And these include brain fog or difficulty thinking, shortness of breath, hypertension, joint pain, insomnia, fatigue. People who were athletes before they got COVID can't even work for half the day without having to lie down and rest. So we don't understand what happens or what causes this long hauler syndrome. We do know that everybody can get infected, all age groups can get infected with COVID in the gold bars, and that the percent of the population that's this age is in the green, but the percent early on of the deaths due to COVID were stacked up for those people who were in the older levels, people who were in our churches, at least many of our churches. But now we know that this red is going down into the younger age groups. So COVID is not something that affects the very old, even though, or I shouldn't say very old, the older, the more seasoned, even though they are more vulnerable for many reasons. This shows you that African Americans have a disproportionate amount of COVID disease and deaths. This shows you the populations in North Carolina, 21%, Chicago, 32%, 26% in Milwaukee of African Americans. But early on in May, the percent of deaths from COVID were 73% in Milwaukee County, where there's 26% African Americans. 67% of the deaths were African Americans in Chicago and 38% in the state of North Carolina. And I could go on and on about this. This looks at the cases across different ethnic groups, with Blacks being here and Latinas, Asians, other Native Americans, Indigenous Americans. This shows you the deaths, with this being African Americans. What are these disparities due to? Well, it's not the first time we've had disparities. We have disparities in disease, which we want to get rid of. I'm so tired of us being the one that get most affected. Why is this though? We know that we have the frontline jobs because we have to feed our families. So we're the ones driving the trucks and doing the things that require that we are involved with people. We have underlying medical conditions from our legacy of enslavement in this country, and where we live and how we eat and how we don't always have access to medical care, or if we do, we don't always want to access it, or we're not allowed to access it, or we're not taken seriously, or we're not discussed the options and given the things that we need to know from the medical field. Also, we have in our own community misinformation that's circulating on Facebook and other places. We were believed not to be able to get infected with things in years past. That's just not true. Culture will keep us from going to a physician when we are not feeling well. And even if we go, we may not be given the test early on. So there are lots of factors that contribute to why African Americans are disproportionately affected. What can we do about these things? Well, here's something we all can do. We can wear a mask correctly. We can not gather. We can keep our distance. We can tell people if we're with them, oh, you're too close, let's back away. Or we can say, are we going over to Auntie's for Thanksgiving or for Christmas Eve? No, we're not going to. And Auntie, don't even hold your usual Christmas Eve family supper, because this is not the year to do that. Let's get together on Zoom or let's wave on the front porch in a drive-by. So wear your mask correctly and distance. This shows you the droplets and aerosols that are in the air. All kinds of masks are more effective than no mask, and you want to be sure that you wear it correctly. You can't wear it sometime. You can't have it over your mouth and not your nose. You can't put it under your chin. You can't have gaps on the side. You can't touch the front of it, because now you're getting anything that went on the front from these aerosols, any virus, onto your hands and whatever your hands touch. When you take it off, you have to put it in a safe place in a bag so the virus then can decay at least for 24 hours, or you can wash a cloth mask with soap and water. So it's important to wear the mask correctly and wear it for the whole time that you're around people that are not from your household. How do we reduce? What can we do? How do we reduce the risk of coronavirus and airborne transmission, including influenza and the common cold, which can prepare the lungs and the nasal passages to be more susceptible to coronavirus? The highest risk is when nobody wears a mask and nobody distances. The next risk is when a person who doesn't think they're infected wears a mask to protect themselves, but we all could be infected. So it's better that everyone wears a mask when we're not with our own household. And then to social distance or physical distance at least 6 feet from other people with the mask is reducing the opportunity for the virus to enter our nasal passages. And then finally, the gold standard is just stay home. Don't gather with people. And if you do gather with someone coming in your house, we had a scare because a housekeeper who we hadn't seen since March, we asked her, or she asked to come, and we knew that was income for her. So we had her come, but she came to our home early, and I was on a Zoom call and I let her in. And then halfway through, I realized, oh my God, I don't know where this woman has been. And she's been here. We've been in the same room. It was a panic. I did get a test later and it was negative, thank God. But staying in your own home away from other people or masking and keeping that distance are the best options for a safe and healthy holiday. So what do we need to do? You know these: physical distance, stay home, limit gatherings, correctly wear your mask, clean surfaces, wash your hands. If you've been in contact with someone, cooperate with the contact tracing and isolate for the designated time. And now we even have research and vaccines that have come online. And so the last few minutes, I'm going to talk about the vaccines. This is what a COVID vaccine clinical trial process looks like, from the research in the laboratories, the preclinical, through the phases of study to the last phase, which is looking at safety and effectiveness in a large group of people for the double dose vaccines. At least 30,000 people have to be enrolled. For the single dose, like the AstraZeneca, which is one dose, we need 60,000 people. And the reason for this is that the studies, which normally take 2 to 3 to 4 to 10 years, are being reduced to a short amount of time. So you need the numbers up. Normally it would be 5 years with 3,000 people or 1,000 people. 2 vaccines, as you know from the news, have now moved into emergency use authorization. Both of these are subunit vaccines, which only have the messenger RNA of one of the ingredients in the virus, the surface protein that allows it to attach to cells. That messenger RNA, not the DNA, but the messenger RNA, is put into a fat droplet that does not contain preservatives or antibiotics or adjuvants. It's water and sucrose and a few other things. And that messenger RNA is then delivered in your arm into your system, where it actually allows the fat particle to go into cells, your own cells, which now in the cytoplasm, not in the nucleus where there's DNA, but in the cytoplasm uses your own cell machinery to make the viral protein, express it on your cells. And now when your immune system sees this on your cells, it actually mounts an immune response, because this little scarlet thing is not you, it's not self. And the wonderfully made immune system says, this is not me, let's mount an immune response to get rid of this thing. And so it does so, but it does it safely. And then you have memory T cells and B cells that now, when you see the real virus, will attack that real virus and thus destroy it. So that's what the vaccines are about. When we look at vaccines, we have some safe vaccines that we've had for years that have gone through 5, 10, 20 years of use, like measles, mumps, rubella, polio, chickenpox, even the human papillomavirus. The COVID virus has been in people, for the people that first started out 4 months ago, for 4 months, and for the large trials for 2 months, which was the minimum requirement. A vaccine has to be administered ideally before disease And we're looking at a subunit vaccine. So we're not getting the whole virus as we do with some other vaccines. In all cases, we have to know that the effectiveness outweighs the safety. And we have to look at considerations like side effects, comorbidities, and long-term adverse events. The only thing I'm going to say about this slide is that these are the issues that have to be figured out before a vaccine is released, and that is, besides its safety and efficacy, the safety and storage so that everybody is getting a good vaccine, the responses to the vaccine, is it blocking disease? Is it blocking infection? Is it blocking transmission? What's the distribution strategy? How do I know that inner city Milwaukee is going to get the same quality of vaccine that Vice President Pence got? It is necessary, let me repeat, it is necessary to have high uptake if we are going to have protection from the vaccine. While we have the vaccine, we still have to use all the preventions that I mentioned before. We do not know if this vaccine prevents against prevention of infection and transmission. We know that it prevents disease up to 95% of the time, which is absolutely wonderful. We'll take it. All right, in other things we need to know with buy-in, we need transparency. This was why my first vote was no, not because I didn't want the vaccine, but because we need to understand exactly what this is, that it does not block infection. It does not block transmission as far as, or we don't know that it does, but it does block serious disease. We need to have clear messages. We need to build trust. We need to have access. We need to have a high diversity of people with many different underlying conditions and genetics in the study to know that there's not some long-term or even short-term effect that we did not see. And we need community engagement of groups like this group and the NAACP and our churches and our networks and others so that we can get the information to our people. So then in closing, how do we navigate this 2020-21 winter season? We have to make a plan for safety and implement that plan. Remain in your immediate home or family unit. I cannot overemphasize this. This is why our hospitals are overflowing now. That's why Dr. Collins could tell us what she's telling us. That's why those stats look so horrible. And the vaccine won't solve that. It will help us move toward being different next year, but we're still going to have to do all these things that we were told to do before that we didn't do, which is why we ended up here. Wear your mask, wear it correctly, wear it whenever you're around people that are not members of your own household who are not infected. And by the way, if somebody in your household is infected, you still have to wear a mask and stay away from them so everybody in the household doesn't get infected. Wash your hands, watch your distance. Don't go to crowds, don't be in close contact. If you must, if you have been exposed or think you have been exposed, get a test. If you're asked to isolate due to contact tracing, isolate it. When it comes to the vaccine, trust that these vaccines are good and that they work. That's what the studies, the incredible science has been designed to show and develop in 10 months. Verify the information. There are going to be several choices. Which one is best for you? When should you take it? Use these consistent proactive things and we can get through this winter season and get to a lighter day. So the takeaway message is you must be proactive to always, with and without vaccine, to use the preventions so that we can shut down the ability of the virus to replicate. With the vaccines, thank God they're aboard. God already sent us the preventions that we didn't listen to. We are stubborn people. We did not hear. But he's now also, or she's now, or we've also now been sent some additional toolkits or tools to go in the toolkit against coronavirus. We have to model and require compliance with these things. We have to not gather. We have to have some restraint and obedience. Obedience is better than sacrifice. We have to know the minimum amount of time if we think that we've been exposed. Every one infection that stops at least 5 other exposures. And lastly, but not least, as we're going to hear more about, you have to practice self-care. Self-care for your emotional well-being, your mental well-being, your spiritual well-being. We're all really tired, but we're not going to get out of this until we learn the lessons of doing what we all have to do to protect each other and ourselves, our communities, and all those around us. So we must be diligent and we must be diligent. What can one person do to make a difference? How can I gather information and be someone who can be a benefit from the vaccines for me and my family? You have to ask yourself, which vaccine should I take? When should I take it? How will I report any adverse events? And be prayerful and thoughtful, but that's each person's responsibility. You can get more information at this YouTube address, which I'll put into the chat. And so with that, I am going to stop my presentation, hoping that you've learned something about what coronavirus is, what it does to the body, why it's so easy to spread, why you don't want COVID. COVID-19 is the enemy we do know. As was just presented, we know that it can wipe, if it doesn't wipe you out, you might be responsible for transmitting it to someone who will have either severe illness, death, or long hauler effects. We don't want to do that. So do everything we can to protect ourselves from that. And so I'm going to stop, and I will be here for the whole time to be able to ask questions and pass the baton, if you will, to our next person. Thank you so much.
Dr. Natalie Mitchell, I know we're supposed to go to the next presenter, and we will, but I don't want to throw the protocol of, you know, this session off, but Dr. Fuller, you were amazing. You were amazing. And I know we said that we're going to, and Dr. Collins as well. I mean, it's just been, this information has just been incredible. And I do know that we said we was going to wait, but I mean, I just need to ask this because so many people in the chat been putting this up. You know, there are people who have been affected, you know, affected by it. And then there are those who are infected by it, Dr. Fuller. And we've been hearing a lot of chatter around the church that if you're sick with coronavirus, all you got to do is boil some lemons, put some turmeric in it, put some garlic in it, and you'll be fine. Is there any accuracy to that?
Thank you, Bishop Walker. And I have colleagues that can also address this. Those things are home remedies that work for respiratory diseases to help us deal with the inflammation and help our bodies to boost our immune system, which is God made to attack anything that's not us. So those things are helpful, yes, but this is a virus that the science shows actually usurps the first defenses that we have, called interferon. When you start getting a cold, you first start sniffing. Or you feel your runny nose, that's your immune system with the interferons, the natural immunity, the coming in. And what we know that coronavirus does is it bypasses that. It shuts that down so fast that the things that we would normally do to boost that kind of protection don't stop it. So those things may help to loosen things, but it's not going to help. It's not going to stop it. What I was told by someone who had coronavirus early on is that God told her to get up and keep moving, keep breathing, keep forcing air through her lungs, and that was going to oxygenize her body and help her to not succumb. The worst thing you can do is to lay on your lungs, and Dr. Collins, you can comment on this, is to be still and lay down and be sick as opposed to having your blood circulate and give your body a fighting chance. So those things help, but at this point, you really do have to keep moving, and you have to boost your body with nutrition and hydration and all those things, and prayer. And you know, I'm a minister, so I think my friend survived only because God spoke to her. She prayed. She said, Lord, what do I do? And he told her, get up and breathe. Breathe deeply as you can, even if it hurts. You keep breathing. The air will get air to your body, and that's going to refuel your body. Dr. Collins, can you address that as well?
This is Dr. Burnett. Bishop Walker, I do not want to violate protocol, but some of these questions are answered in the coming. And so that we can get to the questions and answers, which are numerous in the chat, we would like to be able to keep moving. We are cutting some of our slides. We've been chatting amongst ourselves, we are cutting some of our slides so we can spend more time in the question and answers. If you don't mind, sir, we would like to do that.
That's fine. I just wanted to jump in there because I mean, as I look through the chat, like this is like this question was like maybe asked about 50 people. So, I didn't want no one to kind of go away with not hearing that answer.
Thank you, sir.
That's a good point, Kim. If we can go on, I think some of them will be answered. And I'm sorry if I was overtime, but
oh no, you were fine. You were fine. We needed all of that. And we desperately need to hear from Dr. Collins and the rest. So I mean, you were fine.
Reverend Natalie.
So our next speaker is our chemist, Dr. I've made you a doctor, but she's not a doctor. Cynthia Taylor, she's our chemist. You see, she's graduated from the prestigious Philadelphia High School. Moving down a little bit further, she does work with the Black Doctors COVID-19 Consortium. And she's going to give us some basic guidelines, best recommendations that we encourage you to follow, because as we understand, this vaccine is here, but it's going to take time for it to roll out. So there's things that we still need to do, especially as pastors and leaders, because you have to think about it this way. Someone in your church lets you know that they've been diagnosed with COVID-19. The health department knocks on your church door. What protocol do you have in place? So she's going to talk a little bit about that, some best practices. Cynthia?
Good afternoon. Good afternoon. I do not have the screen. You have been talking to the doctors, so I'm going to talk more about everyday things that we can do. Being a chemist and cleaning is a necessity, and it is also a science, but it's everyday things that we know. For instance, cleaning supplies, Clorox, Lysol, hand sanitizers, hand soap, vinegar, dish detergent. Clorox bleach is an excellent cleaner. It is an excellent disinfectant. You need to dilute it when you use it. Clorox bleach usually dilutes at a 20% ratio. So if you're going to use a gallon, you want to fill it 1/5 with bleach, 4/5 with water. Lysol is the same way. If you're going to use the liquid, if you're going to use the wipes, they are excellent. If you can find them, please let us know. Hand sanitizer, it needs to be at least 70% alcohol. 75% or more is preferable. There are a lot of brands on the market, and when you look at them, please read the labels. Don't just pick up a bottle that says hand sanitizer. Some of them have less than 40% alcohol in them. It's just water. It's doing you absolutely no good. Some of them actually were found to have methanol in them and were causing burns on people's faces. So we're here to educate each other. Please read the label. There's no use in buying sanitizer if it's not going to work for you. Washing your hands. Wash your hands with soap and hot water vigorously. Don't just stand there. Wash your hands vigorously. That is one of the most effective things you can do. At least 20 seconds. 20 seconds. Sing happy birthday. Sing praise God from whom all blessings flow. That's my favorite. Whatever it takes, make sure you are counting 20 seconds. If you're just in there and you do a quick wash, you have done absolutely nothing. Vinegar is a very good cleaner. You want to dissolve vinegar into a 5% solution because vinegar is strong. Vinegar also, though, is very effective in wood and permeating surfaces, surfaces that breathe. You want to use vinegar and water and not bleach, because bleach will kill a permeating surface. Dish detergent, Dawn and vinegar mixed together. Most of you, I'm showing my age now, know that that is the best way to clean a stove, a microwave. You want to clean grit on a bathtub, that is the best way to do it. It also works with this. Just know that if you're using Dawn and vinegar and you want to use it at about a 25% vinegar, 75% Dawn, then now you've got soap on your surface and it might be slippery. So you need to go behind it with hot water and get the slippery surface off, or you're going to have a situation. The various church surfaces, we have metal, wood, plastic, stainless steel, cardboard, copper, aluminum, glass, and ceramics. All of these surfaces are in our churches. They're in our churches, they're in our fellowship halls, they're in our offices, they're in our kitchens where we love to cook, and they're in our homes. All of these surfaces can hold the aerosols that COVID creates. I have a list on here with how long. Copper and aluminum tends to hold it less than a day. Everything else will hold it for a minimum of 2 days. So if someone touches a doorknob, 5+ days. They've had instances where it was still on a doorknob 13 days later. So I'm just saying that to say you need to be very cautious. Wiping it down with wipes, you should be very diligent when you're outside of your house and even inside your house. Keep wipes around, wipe your surfaces that you use all the time, wipe them before you use it, wipe them after you use it. Make sure you have ample cleaning supplies. Get them whenever you can get them. Don't listen to people to say you're hoarding. This is going to go on for a long time. So if you can find Lysol or Clorox or disinfectant wipes or spray, you get it and you put it aside, because if we're going to combat this together, we all need these things. I'm going to talk a little bit about the airborne flow of aerosols. Everyone knows that they say you need to be at least 6 feet apart from each other. What they don't often say is that's for 15 minutes or less. If you're 20 feet apart from someone for 2 hours, you've just broken the flow. That 6 feet apart is for 15 minutes or less in a 24-hour period. So you need to keep that in mind. When you talk about praise team, singing, dancing, or anything else, when you're doing that, you are exerting yourself so your aerosols flow greater. You must maintain a distance of 15 to 20 feet between each of you, not just between you and the congregation, between each of you. Open ventilation. A lot of people say, I have high ceilings, so I've got plenty of ventilation in this church, or I'm in this room and I close the door. No, if the ventilation system is the same through the whole building or through a series of buildings, all of those aerosols are spreading through all of those. Dr. Collins said something in a meeting 2 weeks ago that is very, very vital. She said, COVID is very disrespectful. It has no respect of persons or things. So you need to remember that. High ceilings do not count as adequate ventilations. Many hotels are now saying they can safely hold your conventions because they've had no outbreaks. They don't know. They're not asking, they're not contact tracing. They are saying what they need to say to build business. They don't ask any questions, but I can guarantee you there's not a hotel around that is not using a combined ventilation system. Even if you have 6 different units in a 7-story building, if they're combined, that's one system. And that one system, it doesn't matter if you're in a room with only 4 people with the door closed, you're getting the same thing as that person that's in their bedroom 6 floors up. So you need to make sure that you are cognizant of that. Outside activities. Being outside does not mean that you don't have to wear a mask and you can't get COVID. Being outside just means you're breathing some fresh air. That fresh air is full of aerosols because everyone is not doing what they should be doing. Face masks. There are several different kinds of face masks. N95 and KN95 face masks are 90% or more effective if you are wearing it correctly. Those are mainly set aside for healthcare workers because they are in the flow and treating COVID patients everywhere. You can buy them if you can find them. But if you're just going out every day, there are other ones that are effective for you. If you're just going to the grocery store or just going to make a quick run, because other than that, you should be staying in your bubble in your house when you can. Surgical masks, 75 to 85%. Those are the just regular green masks, but you have to wear it correctly. If you put it on and there's a gap in the side, that means that honestly, you haven't opened it up all the way. Because if you open it up all the way and it goes from the top of your nose to under your chin, it's gonna lay flat on the side. If you only open it so that it barely covers and there's a gap on the side, that means the aerosols are coming in. It's not effective unless it's sitting flat on your face. Cloth masks are okay. They do not provide, they're better than nothing, but you really need that filter. The face mask with a ventilation hole, that ventilation, hole has been found to capture and hold the aerosols. So they are suggesting that you don't wear them even if you're changing the filter. They're better than nothing, but they're suggesting that you don't use those. The gaiter, which is the cloth, I call it a head rag, but it's the cloth rag. The gaiter leaves you open on the bottom and on the sides. So the aerosols are coming in. It's better than nothing. A face shield is only 20% effective if that's all you're wearing. You all know the face shield goes like this, which means everything's coming. The only thing that's sealed is over the top of your head. It's better than nothing, but the face shield is made to be used in conjunction with a face mask that's sealing on your face. The only thing that's 0% effective is doing nothing at all. And unfortunately, we have a lot of people that do that. There are many helpful resources on our website, amechealth.org. You can go to the coronavirus disinfecting buildings, and face buildings is a very helpful resource also. My thoughts and takeaways: wear a face mask. Buy face masks when you can find them. Wear them correctly, wear them diligently, wear a face mask anytime you go out, wear a face mask when you're in your house and you are around others. Wear a face mask even if you take the vaccine. Read to educate yourself and others. I did not do a slide, but the last thing I want to say is take the virus or not. For me, it was a very difficult decision because my husband and I both got COVID. He's a police officer. I'm working out there in doing COVID tests. We did everything we knew to do. We wore double masks, N95s and cloth masks over them. We wiped down surfaces. We were very protective, but we're out in the public. We got COVID. He still has, a month later, loss of taste and smell. I was asymptomatic, which means I was a spreader. We have recovered and gone back to work, but when my decision whether or not to take the vaccine came and the opportunity came for me, I did four things, I prayed about it. I talked to my family and close friends that I knew had my back. I talked to professionals and mentors, and they are all panelists on here today. They talked to me and I said no, and they talked to me again. And then the last thing I did was I prayed again. I woke up last Wednesday morning and I took the Pfizer vaccine. I am so glad I did. I'm looking forward to taking it again on January 6th, my second shot. It is an individual decision, but for me, the decision was clear: life or not. Do I want to have a semblance of life? Do I want to live, or do I want to take my chances? That is a decision each of us have to make. And I thank you very much.
Wow. Wow. That is awesome. That's powerful. Thank you so much for sharing how you made your decision on getting the vaccine, which is important. And thank you for sharing with us how long viruses last on contact surfaces, so we as leaders can be prepared. What do you think about that, Bishop Walker?
Oh man, that was amazing. To Chemist Taylor, thank you so much. You have helped me. I mean, this is incredible. From Dr. Collins to Dr. Fuller to Chemist Taylor, Listen, this is amazing.
I agree. I agree. So next on the deck, I do believe it is Dr. Williamson, if I am correct, because I don't have control of the screen at the moment. But Dr. Williamson, oh, Dr. Burnett, I'm sorry, Dr. Burnett, I didn't have control of the screen. Sorry about that. So Dr. Burnett is next. She is our medical director for the International Health Commission of the AME Church. You see on her bio, the different organizations that she participates in with the World Council of Churches, with FEMA. She is also the pastor of Jones Tabernacle AME Church. She's the president of Resource Promotion and Health Alliance, also known as RAFA. Jumping down to the end, she is a certified professional medical coder. She's completed the Johns Hopkins University COVID-19 contact tracing, so she has a certification. So I'm going to turn it over to Dr. Burnett.
Thank you very much. We're going to take a global look at COVID. I'm actually going to jump over most of those slides, and then we're going to really hone in on some public health measures, many of which have already been talked about. When you look at this slide, you can see how this is taken yesterday evening. I wanted to get us some update pictures. You can see that all over the US, parts of South America, look at all of Europe, these numbers, the bigger the circle, the larger the number. Also, as you look at the US, these are new cases by population. Again, yesterday, they are clustered where we are. One of the things that we have to recognize about public health and our health, there are critical influences. Number one is policies and interventions. What laws, what directives, what mandates, not only that come from our governmental agencies, but look at the mandates that come from God. Has anyone actually read Numbers and Leviticus and all of the directions that we are provided by God regarding our health? They're difficult to follow, but they're there for us. I'll have you know that most of the infection control standards are actually biblically based. So the cleaning and keeping those who are affected and infected with various diseases required isolation. That is biblically based. We know that the isolation that we are to get from to prevent us from or discouraging us from getting COVID-19 that comes from the infection control pieces that actually are biblically based. When we are following the directive to isolate, to sit in our homes, to not communicate physically one with another, to be able to do all of those things, to wear a mask, that's biblically based. We are honoring God when we follow those directions. Everyone looks at this slide and thinks that we're talking about governmental influence, but we are, and we're also talking about God's mandates. We also need to look at our access to quality healthcare, not just access to healthcare, but quality healthcare. One of the reasons that we do this and have been doing this since the end of February on a regular basis is we need people to understand what quality healthcare actually looks like, what questions to ask, providing you with enough information so that you can ask informed questions so that you can become better caretakers of your own bodies. Physical environment, social environment, our behavior, and then actually lastly is our biology that influences our health. We need to ensure that we are taking care of all of those. And do our religious belief impact our health status? This is a slide that comes from 1996. This is still accurate. Our religious beliefs and world views directly impact our healthcare utilization, whether or not we believe that science matters or our health status. I'll have you know that as a physician, and a public health professional, I honestly believe that God has allowed me to gain the knowledge that will help people in their healthcare utilization in order for us to get good health beliefs. I believe that is my calling from God. So yes, that is my religious belief that impacts healthcare utilization and my own health status as well as the status of others. There are 5 key areas for the social determinants of health. They are around economic stability. What are our jobs? How do our jobs influence our ability to gain and maintain our health? Can we access food? Is there food insecurity because we live in a place that is in a food desert? Are our neighborhoods and our built environments made to be able to sustain us, or do they cause harm? Our educational status, can we interpret what is given to us? Do we hear it? What is our literacy rate? And there are actually several kinds of literacy. One is just the ability to read and understand what you are reading, but there's health literacy as well. Do we understand the specific information that is coming to us regarding our health and our health practices and interventions? It's like I say to my accountant, stop talking to me about how to fill out these tax forms. I don't understand a word you're talking about. But when you want to talk to health or talk about health, she says the same thing to me. How do we make sure that our health literacy, our educational literacy overall helps us to understand what to do and what not to do? Our social context, our ability to be religious leaders and participants in our faith increases our ability to socialize and community and be about our community. But what are we saying when it relates to how do we love one another by staying physically distant, but socially connected? Also with housing instability, people that are living in poor housing conditions or no housing conditions, that directly impacts their health. Whether or not we have increased our early childhood education, which sets the tone for all education throughout, are we ensuring that that is taking place? As it relates to our social and community context, and I'm going to talk about this one specifically later, because we need to ensure that our civic engagement is at a real-time high, because that is what allows us to sit on boards, to sit where the decisions are being made regarding our health. We also need to make sure that we have access to health care and access to primary care. We need to also make sure that when we talk about and we go to city planning meetings, that the emphasis is on those things that we need in order to ensure that we get what we need. Is the housing quality? Is it affordable? Are there enough grocery stores in our areas that are providing good, healthy food? And Reverend Natalie is going to talk about foods in a minute, but are we even taking advantage of the fact that some of us have backyards and can grow our own food? Are we looking at crime and violence? What we know about violence is that it can change our DNA, which makes us more vulnerable for all kinds of things. It increases our stress. Looking at the news every day is an assault on our psyche. Be careful to make sure that what we are doing is allowing that which is being seen and taken in by our soul and our spirit is also not causing us stress. But part of the church means that we also have to ensure that we are making a difference as it relates to crime and violence and all of these things. We have to make sure that we inform, educate, and empower people about health issues. We have to ensure that We include COVID-19 education and prevention strategies in all of the work that our ministries do. All of the ministries have a piece of the pie that they can add to their educational components. We have to ensure that services raise awareness and provide means to increase dialogue, be able to have a conversation one with another. It's a public health competency, but we need to ensure that the church, I call it using public health as a framework for evangelism and for ministry. A church that takes care of its people by educating them allows an evangelistic movement. Optimal health. Dr. John Chazelle, who was president of Meharry at one time in Meharry Medical College, said that the great optimal health is your greatest state of alignment, but it takes 5 things. It takes intellectual health, emotional health, physical health, spiritual health, and socioeconomic health. Sounds a lot like what we are now calling social determinants of health. But we created that. He called it pyramids of power, an ancient African-centered approach to optimal health. We've been talking about this for a long time. It is, when we talk about the church is the center of our being and all that we reach and need, we're talking about our greatest state of aliveness, our optimal health. We have to be able to ask empowering questions. That's what you're doing in the chat. We need to make sure that our rest and our nutrition and exercise, and we promote risk reduction and elimination. And we have to move to healing and rejuvenation. And Dr. Williamson is going to talk about sleep, and Reverend Mitchum is going to talk about rest and nutrition. All of these things are essential for our optimal health. And when we talk about socioeconomic needs, we need to make sure that our status encourages and enables us to make sure that our physical needs are met or exceeded. And I'll just say that our church needs to be one of those places that can help us be trained for adequate jobs that will allow us to be able to move forward. So why bother have the body of Christ become an evangelism that reflects public health? Because knowledge is power. It promotes community activism. It shows that we care for our communities. It means that we care for those that we love, and we demonstrate that on the daily basis. One of the things that we know as believers is that we are mandated to love one another. You cannot love someone if you don't put on a mask. We also need to make sure that we are taking care of ourselves. These are the areas that help us to potentially collaborate and work at all levels. We have to heal the nations, and we have to heal our people. That means we have to work together strategically. We have to make sure that we realize that what works for one will not work for another. You can't put a round peg in a square hole. You may have to adapt some of one of the things that is necessary, but there are some things that you're going to have to make fit into that hole. We have to evaluate and adjust constantly so that we are providing the best care that we can. Every church should have a health ministry. Not just a nurses guild. Nurses guilds are important, but a health ministry means that we are advocating for moving forward, that we are educating, that we are providing the best care that we can for our people. As I talked about civic engagement, there are regional and local committees that are being developed right now around vaccine and distribution. Some of us are already on the back end of that table and need to ensure that we get a seat at the table so that when the vaccines are being distributed, they're being distributed equitably. We need to make sure that we sit on disaster preparedness committees. You may not know this, but if your church has a fellowship hall, you are already sitting on your city plans for response for disaster. How do you know that? There's only one way to know that. You go sit at the disaster preparedness committees. Monitor your health daily. Know your own body so that you can be able to respond. Wear your mask properly at all times. Don't remove your mask to speak or preach. And I'm not going to harp on that because Chemist Taylor did an excellent job with this. No selfies, no group pictures, no group events, because it defies the physical distancing that she just talked about. Face shields, she's already addressed. She talked about all of these things on this slide, with the exception of, let me re-emphasize that we need to keep all of our immunizations up to date. There's a reason that smallpox doesn't really exist anymore. It's because we were all immunized. Look at your left shoulder. You have an immunization mark from smallpox. Yes, we may have to do immunizations on a regular basis, like in the influenza vaccine. Also, if you have not gotten your influenza vaccine at this point, unless you have a contraindication, please ensure that you are doing so. Talk to your physician, your healthcare provider, to be able to know whether you can or cannot take the influenza vaccine, and maintain your normal healthcare visit schedule, including your preventive care. If you need a mammogram, go get it. If you're due for your mammogram, if you're due for your colonoscopy, go get it. COVID will not stop the regular process. We've already talked about how to wear a mask. My final slide. Even with the vaccine, everyone must still wear a mask properly, wash your hands, and maintain physical distancing. Be reassured that physical distancing does not mean social distancing. Pick up the telephone, look at Zoom, do those other things that will allow you to remain connected with the body. Amen.
Amen. Thank you so much, Dr. Burnett. Certainly we are connected right now. We are physically distanced, but we are not socially distanced. And so much information that we have been sharing with one another. So if you're still sitting, take a moment and stand up for a minute, stretch, move around for a second. And I know that we're going to be answering some questions at the end, but this is a lot of information. So Bishop Walker, is there a question that you saw that maybe we can throw in here for a second there while you're looking? But again, make sure you stand up, everybody. Move around for a second. You got to get that blood flowing. We heard that COVID-19, causes coagulation, and you may not have it right now, but it's so important to move around. So Bishop Walker, you see a question there that you?
I want to go back because I really desperately want to hear Dr. Collins, as it relates to, some of the things that we kind of hear around the church circle about what we need to do while we are quarantined, like the question that I asked, Dr. Fuller, with the turmeric and the ginger and the lemons and all that stuff. So Dr. Collins, can you address that? And I think the important thing is for me is we talked about the lungs, and do you, because most times when we are sick, we were taught to kind of stay in the bed, drink your liquids and, eat your soup and just kind of lay there. So please, Dr. Collins, would you please help us with that?
Sure. So with COVID-19, we really want you to move around. And for several reasons. It can cause severe fatigue where you just literally cannot get up out of bed. And you see this with people who are extremely healthy, otherwise young, but we want you to keep moving. The second reason why you want to keep moving, remember I said that it can cause thickening of the blood. And the more that you lay down and don't move, the more likely you are to get clots and those types of things. And so we want you to keep moving for that reason. We also want you to keep moving because we want you to breathe. We want you up and kind of exert yourself a little bit so that you are taking some deeper breaths and trying to keep that going. If you have COVID-19 and you're at home, we're asking you to prone, do some laying on your stomach sometime to help with ventilation and doing that. So that's very, very important. Moving and even with prevention, exercising and trying to make sure that you're remaining healthy. But certainly if you have been diagnosed with COVID-19 and you're not hospitalized, get up, move. Turmeric is one of those things that it does help, has studies to show that it helps with inflammation. And so a lot of people do turmeric, but turmeric can have some adverse effects too. In some people, it causes some GI distress, reflux, and COVID-19 can cause some GI problems. So we have to kind of be careful with that. You know, lemons and all of that stuff, you're looking at inflammation, and then some of that is symptomatic relief as well. But with, like Dr. Fuller said, you know, the reasons behind that, even though, you know, we don't always know all the science of why we do it, our moms did it, now we do it. COVID doesn't respond to that. That system that works on is not really available when you're infected. So we have to kind of start looking at some other things. That's fine to do, you know, if you want to do that prophylactically. Like I said, we want you to increase your fluid intake. We want you to increase your vitamin C. For women, a lot of times as we begin to age, we start losing some vitamin D3. So making sure that those levels are where they should be would help. Zinc is another one. Zinc does, you know, generally we'd say, oh, go take some zinc if you had a cold, because it helps to shorten the duration of symptoms. But we also use that in COVID-19 treatment as an adjunct to some of the formal treatments as well.
Great, fantastic. And with that, you know, and the reason why we took another break is because now we got Dr. Williamson, and she's going to she's going to talk about something that happens to us. We got all this information coming. You start to get Zoom fatigue because we're getting it. It's wonderful information, but it's like coming at you. And people are like, got to breathe for a second. And I noticed something. I asked you all to stand. I don't know if you stood. I didn't stand. You got to stand up. I need to see you stand up, everybody, get that blood flowing. There you go. Look at somebody else, stand up. There you go. Cynthia, you're laughing, but you're not standing. I'm looking at you. All right, fantastic. So at this time, we've got Dr. Lisa Williamson. She's going to help us to understand just what we were all experiencing for a moment. We were zooming in and zooming out. But she's a licensed pediatrician, over 20 years of medical practice. She's employed, but as a supervisor of COVID-19 contract. She's a supervisor of the COVID-19 contact tracing team. Got that out, okay? And she works in the 5 boroughs of New York City. She implements and enforces the guidelines over air travel in New York City. She's also the pastor of Calvary Fellowship AME Church there in New York. You see her credentials there. So Dr. Williamson, I'm turning it over to you.
Good afternoon, everyone. I am coming now to switch gears a little bit. I am so grateful for this opportunity. I'm glad Reverend Natalie had us stand up. We're talking now about our self-care because God wants us to honor mind, body, and spirit. Some of the syndromes that we are experiencing now in this pandemic, the main one is Zoom fatigue. Majority of us are virtual. And I want you to know that Zoom fatigue is a recognizable syndrome. It is also known as computer vision syndrome. It can be characterized tension, headaches, migraines, eye irritation, eye pain, blurred or double vision, eye tearing, or eye dryness, excessive blinking, lack of focus. The majority word that you heard me talk about in Zoom fatigue is the eye. Number one, everybody needs to get an eye exam in this season, especially our young people now who are also doing remote learning. I went to my ophthalmologist for my yearly eye exam, and I was suffering from excessive dryness of the eyes. He told me it is because I work remotely. I do church remotely. I am in front of a computer now about 9 to 12 hours a day between work and ministry. Every single tear duct in my eye was blocked. So he prescribed an eye compress that I use every 20 seconds. You heat it up in the microwave for 20 seconds. I do it twice a day. He also recommended what's known as blue light blocking glasses. These are purchasable on Amazon. And what he recommended also for Zoom fatigue is something called progressive muscle relaxation. If you go on YouTube, you will type in progressive muscle relaxation. They even have it for Christians. And it basically allows you from the crown of your head to the soles of your feet to tense each muscle group for a few seconds and then slowly relax them. And it helps you coordinate it with your inhale and exhale breathing. Zoom fatigue is real. And what Reverend Natalie did, if you are on a Zoom platform, schedule breaks into your meetings. For children who are remotely learning, it's really supposed to be 20 minutes, then they give their eyes a 20-second rest, and then they should be focusing on objects at least from 20 feet away. So Zoom fatigue is real. Okay. The next one I want to talk about is compassion fatigue syndrome. Compassion fatigue, for those of us who are on the front line, for those of us who are in ministry, for those of us in any area of human service, we are seeing an increase in compassion fatigue syndrome. Compassion fatigue syndrome is a documented syndrome. It is found in the DSM-5 classification for illnesses. It is characterized by physical and emotional exhaustion, a desensitization and depersonalization. What that means is when we are constantly dealing with people at the extremes of life, when we are constantly dealing with grief and loss and being called as ministers, pastors, professionals, doctors to come and minister to these individuals, what you may start to sense is that your emotion is disconnecting from the service you are providing. It is also characterized by irritability, difficulty sleeping, feelings of inequity, where you are so bombarded by having to counsel people or get people through grief and loss of all kinds, not just physical death, that you feel that what you're doing is no longer making a difference. It can be characterized by weight loss, poor satisfaction. You're starting to get weary in your assignment, headaches. Basically what it is, as those who are being called, more than we are used to being called. As a pastor, I'm dealing with grief, loss, death more than in my 10, 11 years of pastoring. And sometimes as a protective mechanism, your body will start to disconnect the emotional response from your day-to-day. What are some of the treatments? Professional therapy. Hear me say this: being people of faith, your faith is not compromised by seeking professional mental health therapy and counseling. Meditation, once again, you can, if you're thinking about non-committee meetings for your church, I did a 3 series on meditation. Meditation without mantras. YouTube is an excellent source of Christian spiritual guiding meditation. Journaling. Keep a journal. We're having dreams, we're having visions, we're having thoughts. Write it down, get it out from internal to external. Exercise and sleep. Restorative sleep, the sleep where you allow your mind to shut down, your body to completely rest. It is now recommended 8 to 10 hours. Take naps. Most of us are home remotely. If in the middle of the day you feel tired and you can afford to take a nap, take a nap. The other one, and this is always with us, but in a time of a pandemic, it can even multiply itself, seasonal affective disorder. We threw the clock back and your days are shorter, your nights are longer, you're having more nighttime than daytime. It's a type of depression that's related to the change in seasons. It can start as early fall and continue through the winter months. It's characterized by feeling depressed most of the day. And this is where it's not just a sadness, but it's a depression. How do you tell the difference? When that sadness comes to the point that you do not feel like doing your activities of daily living. You have a loss of interest in activities, low energy, sluggish, agitated. Your moods are swinging left and right. Difficulty sleeping, falling asleep, staying asleep. Difficulty concentration, feelings of hopelessness, worthlessness, feeling guilty. Seasonal affective disorder, it is caused by natural of our biological clock in tune with the change of the season. They have known that it can be caused by a decrease in serotonin levels in your body or imbalance in your melatonin levels. Treatment, light therapy. Keep the light around you. I got this great, nice, illuminated light that changes colors. Phototherapy, depending on the excessive or severity of it. Sometimes when you seek professional help, they may recommend some short-term antidepressant or some short-term medications if you're coincide with anxiety. Counseling, talk therapy, wonderful website, therapyforblackgirls.com. There are so many sessions, Christian counselors. All of this can be done remotely, telecounseling. Music therapy, art therapy, meditation. I downloaded a painting app, and you'll see I have a slide. 5-minute self-care break in the day. I'll go and paint a fabulous picture. Takes me 5 minutes, gets my mind off of everything else, gets my eyes off of the computer for a few seconds. Adult coloring books, I love them. Okay. Think trying to advance. Before I get to this slide with just talking about children, a lot of times we forget that what adults are going through, children are going through. Of the over 17 million people in the United States impacted by COVID-19, 11% of those are children. There are over 1 million kids who have been infected with COVID-19. The thing about children are not little adults. Just like in adults, the high risk factors for children are children under the age of 2, children who were prematurely born, had premature delivery. Of course, children of Black and Latinx communities are disproportionately affected by COVID-19. Many of you have heard in the news of the syndrome, the multi-system inflammatory syndrome that impacts children who are infected with coronavirus. That goes back to what everyone was saying. It causes a hyper-inflammatory response, and it could be in any organ, your kidneys, your blood vessels. Many people are saying, why are children not getting vaccinated? Pfizer is 16 and up, Moderna is 18 and up. Pfizer has actually started their clinical trials testing kids 12 and under. I have learned that Moderna also has not started, but will be starting, because the antibody response and the immune system of children are different than adults. What we are seeing in children is an increase in nightmares and night terrors since the start of the pandemic. I consider night terrors extreme nightmares, and night terrors are characterized, your child is still asleep. and they can have intense screaming, crying, thrashing, increased heart rate, breathing, sweating, dilated pupils. What I say to parents, allow the night terror to run its course. If you try to shake your kid out of it, you can actually exacerbate the symptoms. Allow it to run its course. Make sure that they are in a safe environment. And because it's happening in a part of sleep where they're not fully conscious. Adults, please have conversations with your children regarding this pandemic. They are putting on masks. They are hearing death rates just like we are. YouTube have some wonderful, user-friendly, child-friendly videos that can explain COVID-19 to them. They make games out of wearing the mask because you have to understand what you are experiencing, our children. And finally, with this pandemic and this season, you have to practice what's called 5 minutes of self-care every day. Do some breathing, stretch your body, listen to music, meditate on landscape. A lot of us have computers with those flashing landscapes. Just sit for 5 minutes and watch it and lose yourself. Read a chapter of a book that has nothing to do. Make it a mindless reading. Journal some of your thoughts. Go for a walk. Pick up a new hobby or arts and craft. I have always wanted to learn jewelry making. I'm getting ready to start an online class on jewelry making just for something for me to do. Try a new recipe for those of you who are own self-recognized cook. Try new recipes. And this is how in this season, it is about rest and holding on to the main fruit of the spirit for me, which has been joy. God rested. He didn't have to. He took his rest. We have to take our rest in this season. We have to turn the computers, laptops, phones off. Take your Sabbath rest. And I leave you with this. You turn my wailing into dancing. You remove my sackcloth and clothe me with joy. Joy is the reassurance of the Lord in our lives. And through it all, he is Emmanuel, the God that is with us. Thank you.
Oh, wow. Thank you so much, Dr. Williamson. Fantastic, fantastic. And we certainly want to, that's interesting information about children, the vaccines in children, the differences and why there's delay. And not only that, the fact that their immune system responds differently. We have noticed, some of you might have noticed that the chat box might still be disabled, but we're working on that. Bishop Walker, we're working on it. We're working on enabling it. So we continue to ask you to please put your questions in because the questions are just around the corner. I am going to go to I am the last presenter. You all have already are aware of me, so happy to be here. I'm just trying to get to, if I can move the screen forward. So a lot of the information is already presented to you. So I just wanted to share with you again, your health is your wealth. That's not really a new title, but again, as you heard, COVID-19 does not discriminate. So it doesn't care whether you're rich or poor or where you live. And remember this, a scripture where Jesus asked the man, do you want to be well? Well, everything that you've heard from the beginning to the end, from all of our doctors and all of our chemists, the question for everybody is, do we want to be well? And to do that, we have to put some things in practice. The healthier and stronger your immune system, the better you're able to fight and prevent preventable diseases that make people of color at higher risk for COVID-19. And we've already heard what those are: diabetes type 2, hypertension, stroke, some cancers, obesity, premature aging, some autoimmune diseases, even joint pain and inflammation. So the stronger your immune system is, it helps you to address that. And I don't know if you also heard earlier, and I believe it was Dr. Fuller, when she was explaining the process of how the vaccine goes into your body. I thought that was fantastic. And she explained to us being that RNA, part of the RNA, and then she showed you how it goes into the body. But then she also said this, that your body needs to respond to this vaccine, okay? So the healthier and stronger your immune system is, the better your response to all vaccinations, including a COVID-19 vaccination and medical intervention. So Our immune system certainly is made of your skin, your bone marrow, your white blood cells, your lymphatic system, your spleen, your antibodies, and thymus. Just wanted to write a few. Then you have a connection to the vaccine and then public health. I'm going to talk about 6 quick things that we can continue to do to continue to empower your immune system. And then we're going to get to those questions. You want to manage your stress. You've heard that. So make sure you do that. Time management, being flexible, forgiveness, learning to appreciate the quality time. Here's something, Philippians 4. I know what it is to be in need. I know what it is to have plenty. I learned the secret to being content in any situation. And we're not quite content right now. You're waiting for the end. Learn how to manage your stress. And preachers and pastors, we can preach more on this and Bible studies on this so that we can help people manage this time. Number 2, daily fitness. It empowers your immune system. We just talked about the fact, and we all stood up together. You need to move around. Thank you, Dr. Collins, giving us that insight to your friend who, as you stated, the Lord told her that she needed to breathe and get up and move around. Many of us, now you all got a reason to walk 10,000 steps per day. You got a reason to continue to move around because you know it's going to be helping you fight COVID-19. Going to get that blood moving. Fitness is important for your overall body, helps to manage your weight. You don't need expensive equipment, and fitness naturally helps you to reduce stress and promotes clear thinking. You just heard about rest from everybody. Everybody talked about rest. It empowers your immune system, restoration, time for healing your body. When Dr. Williamson was just talking about the brain, your brain needs rest. And when you give your brain rest, you know, you've seen the nooks and crannies in your brain where buildup builds up in those nooks and crannies. And when you rest, it's time for your brain to clear all that out. She talked about naps. And again, you all know the scripture, God rested. So guess what? We can take a rest. Sometimes we act like we're too important to take that pause, but all of us need to pause. No smoking. What do I have to say about that? I don't think I have to say much about that. Don't smoke, don't smoke, don't smoke. You all get that, okay? Moving on, that was number 4. Number 5, hydration. Hydration is important to empower your immune system. You want to keep that blood flowing. You want to address inflammation prior to even experiencing COVID-19 or just living your life. Make sure you stay hydrated. Avoid artificially sweet beverages and very sweet beverages. We always encourage you to get half your body weight in ounces, not cups of water, unless you're on a fluid restriction. Sip on water. You can put in fresh lemons and limes and watermelon to make it tasty. For all of my soda drinkers, you need to stop drinking all that soda. How about some seltzer water with some fresh fruit in it? If you need a little bit of sweet taste, just add a little bit of a natural sweetener. And here's the thing, alcohol does not count for hydration. Remember that. As a matter of fact, it can reduce your immunity. Number 6, fight COVID-19, you need to empower your immune system. Why? Because again, when you get that vaccine, you want your body to have the immune response that the doctors are looking for, that the scientists create the vaccine. You want your immune system to respond. So you want to eat more nutrient-dense foods, which support a healthy microflora, your digestive tract, and no cheese pizza, double cheeseburger, bacon, and hot dogs and French fries. Guess what? They're not nutrient-dense. You need to eat a lot of colorful fruits and vegetables and whole grains in order to prepare yourself for that. Again, eat more phytonutrients, food that grows from the ground, has fiber, that's important to keep everything moving through your digestive tract, healthy fat, antioxidants, and these are foods that grow from the ground. They're helpful to your body. We've already heard about vitamin C, vitamin D, zinc, and spices. You can also do a multi-mineral supplement, but I'm also aware of this. First of all, nutrients all work together. So just eat a variety of colorful fruits and vegetables, whole grains, nuts, beans, and seeds. And we all have different access, or some people have limited access. So maybe some of us can go out and we can buy all those supplements, but maybe some of us cannot. So make sure that you eat a variety of foods. So in the case where you can't go out and maybe purchase the vitamin C, the vitamin D, a vitamin zinc, or zinc is not a vitamin, all the nutritionists will be mad at, the mineral zinc, okay? Maybe you can't go out and get those things, but eat a variety of food, and on the slide shows you different foods where you can get those vitamins and nutrients from, and spend some time outside in the sunshine because our body makes vitamin D. Here's a picture of a healthy plate from the Harvard School of Public Health. And notice that the star of this plate is what? Everybody looking? The star of this plate is vegetables, not meat. Look at it carefully. I know you don't want to look at it. I know you don't. Some of you are like, no, no, no. The star of this plate is vegetables. So most of your plate needs to be vegetables, plant-based. And then if you look in the corner there, when it talks about healthy protein, it says choose fish, poultry, beans, nuts, limit red meat, avoid bacon, cold cuts, and other processed meats. So it's important for you to check out, when you have a chance, check out the Harvard Healthy Eating Plate. And remember, the star of that plate is your vegetables. Another thing I wanted to share with you, you follow a Mediterranean type diet, which is plenty of fruits and vegetables and whole grains, but it also includes meat in small portions, or even a whole plant-based diet. Either one of these has been proven to help you in fighting and preventing disease. And we offer a program called Culinary RX that can be helpful. My next to the last slide is, because I'm asked this question a lot, I want to be healthier, I want and a stronger immune system. Here are my challenges. You've got limited food access, limited money. You live in a food desert. First of all, when you go grocery shopping, buy fresh fruit in season or fresh produce in season, buy low sodium canned or frozen foods. Buy the basics. What I mean by that, buy the flour, the oats, the cornmeal, the couscous, the millet, the sugar, the salt, the spices, the pasta, the beans. Why? Because you can make several meals out of that instead of you buying all the prepackaged meals. Your money is going to go further. Practice financial wellness stewardship. What is financial wellness stewardship? That's avoiding filling your shopping cart with junk food, candy, chips, soda, sweet beverages, prepackaged cakes, donuts, and treats. They've all left the meeting now, Bishop Walker. I know they have. But anyhow, financial wellness and stewardship. Stop filling your carts with that. Your money will go further. You can have some meatless meals. You don't have to have meat with every meal. And you need to realize that meat is the most expensive thing that you may purchase. So you don't have to have it with every meal. Try some meatless meals. You've heard of Meatless Monday, so try them. If you only have a corner store to go to, same thing. Avoid filling it with that junk food. Look in the freezer and refrigerated section, for the fruits and the vegetables. If the canned vegetables and the fruit there has a lot of salt or sugar, drain it, rinse it, then you can cook it. Remember this, healthy food does not have to be expensive. If you're a brand name person with food, get away from just buying brand name. That will save you money. We heard earlier about a garden with Dr. Burnett. Grow your own garden in your home, your church community. And for church food pantries and the meals you serve, I'm asking all the church leaders, your culinary staff, be a role model. Serve and offer healthier choices to help your members and communities fight and prevent disease. You know the scripture in James, it says, you see someone out without clothes or food, you say, hey, be well or pray for them. We got to do more. We got to offer them. Practical things that help them meet their needs. On the other side, Dr. Burnett went over health equity for us, but I did want to mention this. Some of you have health insurance. You have health insurance, you have access, but you're not making healthier choices. You got to make the choices. You got to put your faith in action. So make healthier choices. Practice that financial wellness as you move forward. And definitely this is my last slide. Your health is your wealth. So healthier and stronger your immune system, the better your ability to fight and prevent preventable diseases, COVID-19, and to make sure you're going to have that good immune response that you need for any vaccine. And we've all said it. Continue to wear those masks, wash your hands, and physical distance. We are physically distant right now, but we're not socially distant. My dear friends, I pray that you enjoy good health and that all may be well with you, even with your soul. So now, Bishop Walker, we're going to go to that chat box and check out those questions.
Wow, it's so many questions, but I want you guys to help me out as well.
Yes.
But I think the very first question I think this is directed to our chemists, okay? And the question is about the mics. How often should we change mics, or should we spray mics, or we have these little coverings that we have at our church. Is the coverings of the mics, is that sufficient?
So the first thing is every person should have their own microphone. You should not be sharing microphones. But the proper way of cleaning a microphone, that covering is just a covering. It needs to be thoroughly cleaned. But once you take that off, there's a metal covering which needs to be cleaned with a disinfectant. You need to take that off. There's a undercarriage because aerosols are very small microparticles and you can't see them, but they get in all those surfaces. So you literally have to take the microphone completely apart and clean it. Each person should have their own microphone. Wiping off the top is not doing you any good at all. One other thing before we go into the questions I forgot, I did not mention, I won't say I forgot, is if your office is attached to your church and you use the same ventilation service, you can't just go into your office for a meeting. You can't just go into the kitchen to get some supplies to give to the needy. That ventilation system is going through the whole building. So you can't say the church is closed, yet you're going into your office. You can't keep supplies to give to the needy and they're going through that ventilation system and then you hand them something that has COVID on it. Unless you've cleaned it and sealed it in a plastic bag, it is a possibility that the aerosols are on it. So you need to keep that in mind because we're seeing that more and more. People are saying, oh, I'm just going to go in here. Yeah, the church is closed, but we're going to have a meeting in the fellowship hall. Or we're going to do this in the kitchen, but the church is closed. It's all there. So please keep that in mind. Microphones, each person have your own. Each person clean it before you use it. After you use it, put it in a sealed container. Thank you.
Wow, that's good. Here's the next question for anyone that want to answer. Can an individual previously be infected, but now they're out of quarantine past the virus?
I'll answer. Yes. The thing is, in the quarantine does not guarantee that you're no longer testing positive. As Dr. Fuller mentioned, there are some people who are long haulers, and there are persons who have become asymptomatic, have been symptomatic, been in quarantine for that period of time, but may still be positive for COVID-19. And so even though they're asymptomatic, the thought is that they can still pass on the virus, although that is being studied a little bit more.
Great. Here's another question. If someone has immune issues and they have allergies, it is said for them not to take the vaccine. Is that true? Anyone?
It is not true. We have found that, well, Dr. Burnett perhaps can answer better. It depends on what the allergies are and how they're handled. Dr. Burnett, are you there?
I am, yes.
Do you deal with that since you know allergies?
Yes, ma'am. It does depend, Dr. Fuller is correct. It does depend on the type of allergy and how severe the allergy is. We've all seen the news where there have been 3 or 4 people who have had what's called anaphylactic reactions, where their immune response is so intense that they potentially could drop their blood pressure, have problems breathing. But those have been few and far apart. I also have a peanut allergy and I carry an EpiPen. And my first response when I saw that was, there is no way I'm taking this vaccine. But having read more and more, it will depend on, and after conversation with my physician, it will depend on which one, and that's what we're waiting on, is which one will be best for me for a lot of reasons. But it should not prevent us from taking a vaccine, but we do need to ensure that you are holding a conversation. That is not a blanket statement. You need to hold a conversation with your physician, your healthcare provider who knows your body. And if you don't, which is even more important, many of us don't have primary care physicians, you need to get one. You need to get somebody that can talk with you one-on-one about your personal situation.
Dr. Burnett, if I can jump in for a second, Bishop Walker. Dr. Burnett said something that's important that we discussed earlier as a team. There are several different vaccines. Well, first it was Pfizer, now there's Moderna, others are on the way. And so, as she's just saying, ask questions of your medical provider. You can even, if you prefer one or the other, you may not know which one is coming to your local area right now, but ask them, are you distributing the Pfizer one? Ask questions. Are you distributing the Moderna one? Ask questions when the next one comes out, so that you will be informed. Don't be afraid to ask those questions. I just wanted to say that. Ask them which one they're giving.
Also, they ask you a series of questions before they administer the vaccine. One of those questions is, do you have an EpiPen? And they have listed several different allergies. Certain allergies that require EpiPen will disqualify you right now unless you actually say, I actually said to them, I've spoken to my physician about this and this is okay. So even the people who are administering it, there is a list of questions they go through. And if one of those questions is no, you're still not going to be administered the vaccine. So your first rule is to go to your doctor, because that way you can answer the other questions with knowledge and power. I was able to tell them, I spoke to my doctor and this is what we decided. And they gave me a variance because of it.
Someone has in the chat room several questions about penicillin allergy and taking the vaccine.
Again, all of the allergy questions are related to what type of allergy, what is your reaction. Even penicillin allergies are not necessarily anaphylactic reactions with the blood pressure and shortness of breath response. Some of them can just be cutaneous. For penicillin, for me, I break out in a rash. That will not prevent me from getting a COVID vaccine. You need to ensure that you are holding a conversation with a quality care provider who is listening to you, that you can understand. Does not make sense to go to someone who is not willing to break all of this down for you. If that's the case, find a new physician.
Also, on that line, someone asked in the chat room about children who have asthma and taking the vaccine. Right now, understand that the vaccines that are coming out are 16 and up. The same question, talk to your provider. We do not have any research about children younger than 16 as those trials are put forth. If those demographics and conditions are in the vaccine trials for children, keep your eye on the research, talk to your pediatrician. But remember, right now, under 16, they're not getting a vaccine. Asthmatics, talk to your medical provider.
So I just wanted to elaborate. So, because there are a lot of studies, a lot of questions in the chat about specific conditions. Let me say that the vaccine trials have only covered some things to get to what was required for emergency use, because we are in an emergency. And that was that they are 50% effective or efficacy, meaning that, and I'll explain that in a minute, and that they, after being in people for 2 months, at a minimum 2 months, there were no adverse reactions that were severe for these vaccines. And so that's what both vaccines have cleared. What has not happened is that we have not been in a large group of people over time. So both vaccines have been in 15,000 people, which sounds like a lot to us. But if you think that this is going to ultimately go to, if you include children, over 300 million people in the US and even millions of thousands of millions in the world, there are many conditions that have not been tested. And that is why it's so critical, one, to talk with your health provider or somebody who knows your health. Let your family know what you're thinking, what your issues are, talk it out. And then thirdly, for both vaccines, and I presume for anything else that will be approved, there is an extensive network of FDA, CDC, and health providers who will be reporting into the system any severe or any adverse effects other than the initial immunization effects that come up. That's important in the phase 4 studies where people are now saying that would be done with any drug or vaccine, but it's even more important because this is a emergency use authorization. So if Dr. Burnett gets the vaccine, and heaven forbid, but she gets some sort of response, she should report that to her primary person, as well as there are other websites and places that she can put that in, such that when you accumulate these from all the people that now, the masses that will be getting this, will know more 6 months from now, or maybe even 3 months from now, what are the counter indicators or what are the things where people shouldn't get this. Maybe someone with sickle cell shouldn't get that. We don't know now. By the way, Moderna was the one that included between 25 and 40% of people recruited who had comorbidities or underlying issues into the vaccine trial. So they tried to spread it out more and not just look at healthy people, but look at people who also might have underlying conditions, as well as they followed the people more closely to talk with them rather than having them only report if something went wrong. And I'm going to answer another question while I got the mic here, so to speak. One of the questions was, does this protect against disease and infection and spread, or does it just protect against disease? The way the studies were done is the endpoint they were looking for was whether the people in the study, and they divided them into placebo and to vaccine people randomly. Did the people who were in the study, regardless of where you were, because it's a blinded study, did you get symptoms of COVID as you went about your normal life? And that means using masks, isolating, whatever your normal life is. Did you get symptoms? When you got symptoms, whether it was a headache or fever, a body ache or shortness of breath, you then called in and said, I have this symptom. They then bring you in, give you a coronavirus test. If you are positive, then you are counted as someone who was exposed and came up with symptoms, which is the endpoint for disease. They ultimately had to get to a certain number of cases, which was about 150. Both of the companies got up to around 190 cases of COVID symptoms. When they broke the code, most of those symptoms were in people who did not get the vaccine. Most of those symptoms were in people who got the placebo. So something like 180 people who had symptoms got the placebo, 11 who were in the vaccine trial who got the vaccine had COVID-like symptoms. So we know that the vaccines are highly effective against blocking symptoms. We asked, and we do not know if it blocks infection. So if you have the vaccine, you're protected against severe disease, which is incredibly necessary and important. Let me not run by that. We know COVID has terrible effects, including death. So that's a huge, huge plus. We do not know, as far as getting to the end of this pandemic, if it protects against me getting infected and now shedding virus so that I can infect other people. And now those are studies that are ongoing that we don't know. So you still have to act like you're infected, even if you have a vaccine. We also don't know when that immunity, that protection wears off. Does it last for 3 months, 6 months, a year, 3 years? So if you get the vaccine today, will you be still immune by Easter or Resurrection Sunday? We do not know. Those are things that are ongoing. This has been approved for emergency use, which, by the way, keeps the companies from being liable if there's anything that happens. But it is necessary at this point because we are in a crisis of COVID-19. So I hope those things help you to sort of get a picture of where we are.
Dr. Fuller, there's another question for you. This question says, if you have antibodies, do you need to take the vaccine?
That is going to be a personal decision, but I would say yes, because the antibodies made in the natural infection are to the whole virus. Some of them are protective, some of them are not. In contrast, the vaccine is to that one spike protein that generates what we call neutralizing or protective antibody and protective T cells. So that's going to give you a specific high boost of antibodies that will protect you greater than the natural immunity. And as a matter of fact, studies show that people who had natural immunity versus people who got the vaccine, when they got the vaccine, their immunity boosted. So the answer is, if you are comfortable with taking the vaccine, then yes, having had COVID should not keep you away, as our chemist Taylor said, from getting the vaccine because you already had COVID.
I have a question that I want to direct to you as well. You mentioned in your presentation that the coronavirus kind of hit somewhere around December 2019. Is it possible that the coronavirus was here before that date?
It's possible. Yes, we had coronaviruses. We've had 4 different coronaviruses that we know of, and our physician colleagues can tell you that sometimes when people come in with laryngitis or bronchitis or severe, I've had this, I can't get over it. You don't usually culture that virus. Sometimes that's one of those coronaviruses. So we've had coronaviruses. Did this one evolve first in China and come here as we think? That's what we think. I don't believe it was created. I don't believe it's a conspiracy. So, by the way, I'm going to use my microphone to say, get rid of all those conspiracy theories. This is a real virus. It is here. It is among us. It affects us. Anybody putting stuff out about it being Gates' conspiracy or anybody's conspiracy, just walk away and take down whatever it is that anybody says, because that is just so distracting and unnecessary and of the enemy. So we don't know, but the data say that this particular strain evolved in a cluster last December as a new virus.
Here's another question. It says, if you are positive for COVID-19 now, can you take the vaccine while you're positive? That's for anyone.
Physicians? I have an answer, but you go ahead.
If we're talking about active disease, the indications have been, and this is presumptive because that was not actually tested, to see whether or not you would wait the 2 weeks and then take it, because you don't know how long your immune response is going to be. That's if you're talking about active disease. If you're talking about I was positive, because some people can have positive antigen tests for an extended period of time, but no longer be symptomatic. Those people, we presume, and I'm going to defer to Dr. Fuller, can actually take the vaccine.
I don't think it was discussed at the FDA meetings. What was discussed is if people have been infected previously, but not if they have an active infection. But my reasoning says if you have an active ongoing infection, that's not the time to get the vaccine. But I'll defer to my physician colleagues.
I would agree with that.
I'm going to say that as well. When you have other active illnesses, we don't vaccinate you at that time. We wait until it's not active and then provide the vaccination.
And the reason for that is your immune system is being boosted by a vaccine. So if it's already being challenged by something else, you don't want to, you're going to get a less of a positive or strong boost of what you're putting in to boost than if you only had the attention of your immune system solely to attack what you put in for the vaccine.
I saw there were several questions that seemed to be asked, Bishop Walker. People who are 70, 90, they're a little bit nervous. Maybe one of our colleagues can answer that. You know, they're nervous about taking the vaccine because of their age. I saw a few, they're 90, they're 70. I think one lady said she was 100, I think I saw.
Can I answer that one?
Sure.
So I think all of my colleagues have heard us talk about this because we really did meet beforehand to think about what was the message to our communities of color now that the vaccines are approved. And let me go on record saying I'm delighted they're approved. I think we're in a crisis and we didn't use what we already had. So anything that we can get that's shown reasonable efficacy and reasonable safety should be part of the toolbox. I think Dr. Collins and Dr. Chemist Taylor both said they will get or have gotten the vaccine. I am in this position. I am of the age, I think I'm in 1C or something like that. I am not going to get it yet because I can't get it yet, even though I work at a medical school. So it's probably going to be at least a month or two before I'm eligible, and I will make that decision at that time. I did fill out the form and get in the blue queue, as they call it, to have my name called up, but I can always say no because I want to see some things. And also I am not out in the workforce, frontline person being exposed. I'm at home with my husband, who's also a university professor, and we're home. We're not out there. So that vaccine should go to someone else. But my 96-year-old mother, who passed in May from diabetes complications, who was in the hospital for 14, 17 days, and I couldn't be with her, which was very, very, very difficult. So I can only imagine what's happening for people whose families have COVID and they can't be there. I can't even fathom that. But for my mother, who lived in her own home and had people who come in to help her with her cooking, and her great-grandchildren, she's not out there, but she had an underlying serious disease, diabetes. She managed for 40 years, and she was 96. So I would say to her, Mom, under all these circumstances, carefully weighing the benefits and the risk and the outcomes with COVID, I would recommend that you get a vaccine now. And for me, I have one that I would recommend over the other, but I would say go ahead and get a vaccine, because your risk of COVID, which has known severity in older people over 65, and especially also even younger people with underlying conditions, those are proven things that we see every day. So Mama, I would like you to get the vaccine. And if she said, are you gonna get it? I would say, I will probably get it, but not yet, because there are people ahead of me who need it more. And I just don't like to put things in my body. When I was anemic and asked to get a blood transfusion, I kind of said, can I do this with iron instead? And that's what they said, you can. So that's just particularly me and knowing that I'm protected. But I advise you to look at your circumstances. So I would give this to my mother because I would want her to be protected from potential COVID disease.
Can I just jump in on that? I think for seniors also, it's good to look in your living environment. My mother, who is 89, lives with me. I do prison ministry. We still operate our soup kitchen weekly. I have a college-age daughter that comes and goes from North Carolina in conjunction. So when those conditions was discussed with my mother's primary care doctor, she's getting it because of her surroundings as well as her age. And for those of you, I know a lot of us focus on the employment that we have, but also consider the ministries that you're doing. If you're doing ministries that takes you into a jail, that you're dealing with vulnerable populations, you have to take all of that when you're making your decision to get vaccinated.
And may I add one quick thing, Bishop? What we've asked the FDA and the CDC and others to do is to broadly be transparent about the side effects to expect from the injection, so people know, I'm not afraid of something if I have an idea of what to expect. And when I see those things, then I don't panic. So we have said that information needs to go out broadly to everyone, what to expect, and then where to report if you see something that lasts longer or that concerns you. And so that is something our community is demanding. You should never get a vaccine where there is not extensive information and opportunity to ask questions. My university has a 3-page list of things. Do we know this? No, we don't know this. Is this? No, we don't. So there's a frequently asked question list that you should look at.
This is so amazing. We have about 8 more minutes. And so we're asking everyone who have questions, we're going to try to get as much as we can in within the 8 minutes. But this is to all of our physicians. Does the vaccine prevent you from getting COVID-19, or does it prevent you from from the severity of the illness and death?
It prevents you from the severity of the illness and death. It does not prevent you, as we do not know if it prevents you from infection or shedding. That's a big question we do not know. But it does stop the illness, the symptoms, and the severity of illness, yes, but not, we don't know about infection and transmission.
Okay. The other question is, what is the difference between the vaccines as it relates to Pfizer and the other companies? Or is it all the same?
All right, I guess I get to do this because of the vaccine stuff. So Pfizer and Moderna are the same technology. They're the same, what we call platform. They're both the messenger RNA in a fat cell. So you're not getting the whole virus. You can't get infected from it. It doesn't bother your DNA because it never gets where your DNA is. Those materials dissolve away in less than 18 to 24 hours. So those two are similar. Moderna told us there are no animal or human products used to make their vaccine. There are no preservatives, there's no adjuvants. We did not get to hear about Pfizer because that's proprietary information. Moderna did do studies along the way to monitor their people. There's one other vaccine that has not come up yet for FDA approval, but I know the trials are going on, and that's with AstraZeneca, which is a very different kind of vaccine. It's a one-dose vaccine. With the Pfizer and Moderna, you have to get both doses to get to the 95%, and you don't want to mix them. You don't want to get Pfizer for one and Moderna for the other one, or vice versa. Whatever you get, you stay with that. But there is another, those are called subunit vaccines because there's only a little piece of the virus. I use this analogy, if my fist is the virus, those vaccines are seeing only my thumb, which is the attachment protein. So they're making immune response to my little wiggly thumb here. The other vaccine, AstraZeneca, is taking the gene for the thumb and putting it on a different virus, putting it on an adenovirus, which is a circulating virus. Sometimes when we get a cold, it's from adenovirus. So it's taking that gene and putting it into adenovirus and putting the adenovirus, which won't hurt you in your body, and asking it to produce the coronavirus gene, which now gives you immunity to that. So they're two different platforms. You only have to take it once. So for some people, that may be the choice. For others, it might be one of the other vaccines. And there may be others coming online, but right now we only have two.
Here's another one. One of the slides said for you to be 6 feet at least distance. What is the real distance?
It depends on what you're doing. If you're only going to be around someone for 15 minutes with your mask on in a well-ventilated space, then 6 feet is enough. If you are in an area, and our chemist talked about this, if you're in an area where there is very little ventilation and or there is projection of voice, i.e. singing, speaking, preaching, etc., it's 20 feet, and that 20 feet needs to be a very limited period of time. And that's 20 feet between each person. Praise teams, I'm watching on Facebook and other things where praise teams are standing 6 feet apart, but they're 20 feet away from everybody else. And Dr. Fuller is holding her head because we talked about this last night. I've actually had to come off Facebook because I can't watch it anymore. I actually took a 4-day break because Facebook has been one of those places where, and Twitter, one of those places that I've been using to get information out, but I could no longer watch it because it was upsetting my spirit so much. So please, people, stop it.
That 15 minutes or less goes for everything in a 24-hour period. That's not just for a period if you're at church for an hour. That's a 24-hour period. So you need to take that into consideration. That's why it is vitally important to stay in your bubble. Vaccine or not, if you're not staying in your bubble, you're not wearing a face mask, you're not doing your due diligence, this pandemic will never quell. We have to do all of the above. In addition to prayer, prayer is first, but we have to do, God gave us this knowledge. He empowered us with this knowledge to share so that we can be the example to quell this pandemic.
Bishop Walker, can we go back for 1 second? I would just, Dr. Fuller, when you were mentioning Moderna, isn't it one dose? I thought it was one dose. Did something change?
No, Moderna and Pfizer both are 2 doses.
Okay, just wanted to, okay. All right, thank you. Just wanted to,
The J&J one is one.
okay.
And the AstraZeneca and Johnson & Johnson are 1 dose.
Really, one dose, okay. I wanted to say to Dr. Burnett, thank you so much for bringing that up and bringing that out, because I see so many people on Facebook, and there are churches who are back in church, and it's unbelievable. And so I think if we just keep pushing that type of information out, because especially with the praise teams, and I know there's choirs, of course, everybody knows I love choirs, but we just haven't been together. We said we can't do it until, we get more information on this. But there's been choirs that have been back at churches and they're not practicing. But you said 20 feet.
Yes, sir.
Okay.
Imagine that you're in a room and everything that goes out, let's suppose there's one person in that room that has virus reproducing. They're putting that into the air, right? So if you're in that room, I was in my house when our housekeeper came, who hasn't been here since March, and I panicked because it's like, oh my goodness. She came into the room I was in. I was on a Zoom session. She came early. She came 2 hours early. And I was like, I can't get out, right? And then she knocked loose my Zoom thing, and I was like, oh Lord, help me. So 4 days later, I got a test, and thank God I was negative. But just imagine that those things are going into the air. And if you are, however long you're in that same room, if you breathe in even a few, that's all that's necessary. This is a very tenacious virus.
And you think about this too, Bishop Walker, many of us are closed, as you said, but some are open. What about tomorrow? Those of you who are open, you have the service, going back to the chemist, are you cleaning? I bet a lot of pastors and church leaders would look back. You have not been cleaning after every time someone left that church, walked in the office, walked out of that office, left that space. You have not been doing that, and placing people at risk, And
it's every time you leave a room, not every day you have service. If you have Sunday school in one room and then you have another group come in, before that second group comes in, that room has to be sanitized. So if part of your sanctuary is being used for Sunday school, that whole sanctuary has to be cleaned and sanitized before you can have service. You cannot mix it. You have contaminated that area. So you really, 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 that's why I kept saying about meetings and going in a fellowship hall. You can't just go in there and pick up something.
Bishop, just
aerosols. Yes, ma'am.
Bishop, so something that was said at our church is that a loving church at the moment is an empty church building. The church is not in the building. The church is in us. And as leaders, as ministers, as people of God who need to hear and should be hearing what God says, he said that in the last days that we would worship him in spirit and truth. It didn't say in a building. So the worship ability we have is not dependent on going inside together, that we're putting our people at risk. If we love them, then we should say, don't assemble now. Let's use the virtual means. And yes, that may mean something for our finance, but our Father owns the cattle on 1,000 hills. And if we don't have faith enough to obey him through this and save lives, then what kind of faith do we have? What are we doing? Are we worshiping the spirit of worship and religion, or are we worshiping the true and living God? People are dying because folks can't seem to get this through their heads. And I don't get it. I don't understand why we cannot do this.
That's
One
good.
of the things that, let me just add, it's one of the things that in my church, my congregation has become closer.
Absolutely.
Because it is now required of them to speak to each other. I had people that said, I hadn't talked to anybody in church other than on Sunday morning the rest of the week in 20 years. But now I talk to them every day. A 5-minute phone call, an hour phone call. Now my congregation can say they know each other. And they're also being able to, being equipped to do ministry and the sources of funding that we would have used for turning on the lights and turning the oil up, we are now putting into ministry. So we are actually following the commission of God.
That's good. That's good. That's real good. There's a few pastors that's online, and they heard about the AC unit. So here's a question. How do we properly clean our AC unit and keep it clear from COVID-19?
Can I answer that as a pastor who, what I did, and I tell people, we brought a professional company in. We brought someone in to evaluate the ventilation system. We made a line item budget for that. We have developed this new ministry, COVID Clean Ministry. And we assigned people to that ministry with various skill sets in the church. The best way to find out about your ventilation system is to bring someone with the expertise. As a small church, you can partner with another church to share the expense of the visit. Okay, so that is something that we're looking into now, is partnership. But for your ventilation system, some companies will give you a free consultation, a free evaluation and assessment of your ventilation system, and then they will make recommendations for you. But this is something that really needs to become a line item budget. There has to be some reallocation of funds for it, because it's a priority now. And also, if you can partner with each other to share the expense.
And that's partner across denominational lines.
Absolutely.
The churches, I say this all the time. I don't believe that there are AMEs and Baptists and Pentecostals sitting in different spots in heaven. I just don't believe that. So we need to be working together. If you have 2 churches on your block, do it together, regardless of what the denomination is. And if it's a synagogue that's sitting on your block and not a Christian house of worship, it doesn't matter. We're all in this together. The other thing that we have to do is ensure on the AME Church Health Commission website is a reopen document. It's a 25-page document. They painstakingly, all of us wrote, and then vetted with some folk to ensure that it worked well, giving you painstaking step-by-step procedures to be able to re-enter your building. You don't have to be able to re-enter your building in the next 6 months, but at least look at it. It's downloadable. Look at it and say, these are the steps I need to be planning for. Because one of the major things we say is practice. Take your small group and practice first.
It's good. This has been some valuable information. Can we all give the Lord a praise right now by clapping and putting in the chat and just, oh man, it's just been great. Thank the Lord. Dr. Fuller, Dr. Burnett, God bless you. Our chemist, Dr. Taylor, and to Dr. Lisa Williams. And of course, to Pastor Mitchum and to our bishop. Thank God for you, Bishop. Thank God for all of you. And I mean, this has been phenomenal. It's just been a great conversation. To those of you that held on and held on all the way through, we still have a little over 200 people on. That's really good.
Amazing.
Good number. They held in there for 3 hours, y'all. We was on for 3 hours. Yeah, really good. This is really great. And I think I want to, you know, close this by really piggybacking off of Pastor Burnett, that it's all about the unification of the people. And we have to break down these walls of denomination and get rid of the separation and segregation within the body of Christ. And I think one of the things that COVID did is, I think COVID came to destroy that, you know. And like said, Pastor Burnett, we have to do this together.
Yeah.
We have to do this together. And I think sometimes God allows things to happen to bring his body, you know, together. And I feel that today, you know, of course, I'm Pentecostal, and of course, you know, the way we were taught back in the day, we kind of stayed by ourselves, you know, and I kind of broke the mold today in a big way. I broke the mold today in a big way. And I think that if we extend our hand to each other, I think this is the will of God for our lives, And I concur with you that there is no space for Pentecostals and space for the AMEs and space for the Baptists in heaven. We all gonna be there.
Amen.
We all gonna be there. So if we are all gonna be there in heaven, we should all be able to get along on earth. And I really believe that this COVID-19 pandemic has pushed us closer to the spirit of unity. So I thank each and every one of you. I love you guys so very much. Thanks to the bishop, and thanks to Dr. Mitchum, who came to us and presented the idea. And thank God for an ear that can hear. Because I heard the Lord, when you spoke to me, Dr. Mitchum, I heard the Lord in my ear said, do this. And so many people were blessed by it. And of course, we couldn't get to every question, but hopefully we can do this again.
And we thank you, Bishop Walker. We want to say that we thank you, sir. Thank you so much for partnering with us, for opening the door. We will make sure we have more breaks next time if you allow us to come back and do a follow-up. But we thank you so much. Your leadership, you know, saying yes to the Lord, so powerful. So many lives are going to be changed. So many lives are going to be saved. So we thank you.
Additionally, we are working on an FAQ, so I'm actually trying to download the chat now so that we can ensure that we are going to answer, save chat, here we go, that we can answer these questions that we did not get to.
Good.
Maybe we should say how people can listen to this again for those persons who were not able to join us live.
Well, what I did, I recorded it, so I have it on record, so I'm going to be able to record it again. Play it again, and also I'm going to put it on my social media as well, and our church social media. So if we all can do that, that'll be perfect.
So if I just may say, the other thing from the FDA panels is that this sort of forum needs to happen focusing on the COVID vaccine in all communities, but particularly in communities of color, so we can help build that trust that's so necessary. And the reason that's necessary is not only for us. The train has left the station with the vaccines on it. We can't change that. We don't want to be left standing on the platform looking like, well, how come we didn't get on the train? So we need these kinds of forums, and therefore Bishop Walker, and to our AME Health Commission, Reverend Natalie and Dr. Burnett, thank you all so much for making this possible for at least 300 people. And we need to do it more and more. And I bet there are going to be funds available to do this if we pay attention. Thank you so much.
Thank you. Again, thank each and every one of you. God bless you. I pray that you guys have a blessed day and a blessed day tomorrow virtually.
Stay safe.
Stay safe. Stay safe. Keep those masks on, and please practice social distancing. And remember, y'all, remember that 20 feet now. That was important. That was so important. God bless everybody.
Bye-bye.